This is a board workshop of the Board of Trustees of the McAllen Independent School District, which is being held today, Monday, April the 4th, 2022, which started today at 5:30. It's exactly 5:30 p.m. We are in the Dr. Ricardo Chapa Boardroom Administration Building in McAllen Independent School District, 2000 North 23rd Street, McAllen, Texas, 78501. At this meeting, there will be discussion of the board on items and subjects listed as follows. And we're about to go into that. We called the meeting at 5:30. We're going to item number 2. There is no public comments, so we'll now proceed to item number 3, unless the board has an action at this time.
Mr. President, if I may.
Yes, sir.
I know we can't vote on it because we don't have an actual quorum, but could we move up item 5A, if you would, please? Till
Yes.
maybe more of the board members come in for the rest of the discussion.
Yes, sir. I have no objection. Does any board member have an objection? With no objection from the board, you're correct. We couldn't vote, but we have no objection. So we'll now proceed to item 5A, discussion of benefits overview. This is under discussion of 2022-2023 budget, human resources, 5A specifically. Dr. Gonzalez.
Yes, sir, Mr. President. The Human Resources Division will present on the funding of the district's medical plan and other benefit-related information. Mr. Todd Miller, our Assistant Superintendent for HR, will share more information, and this item is for information purposes only. Mr. Miller.
Thank you, Dr. Gonzalez. Before I turn it over to Mr. Andy Silva, the Director of Employee Benefits, Safety and Risk Management, I would like to thank Andy and his team and Valley Risk Consulting for working so diligently to manage and maintain a comprehensive and cost-competitive benefit program for our employees. So thank you, Andy. The floor is yours.
Thank you, Mr. Miller. So, good afternoon. I'm back this afternoon to talk about the district's medical plan. I'll be discussing some funding, some cost containment history, and some plan projections, all as background for 3 medical plan recommendations for 22-23. As Mr. Miller mentioned, Mr. Roger Garza and Javier Leal, Valley Risk Consulting, they are in attendance here today in case there are any questions that might come up. So let's go ahead and get started. So, first of all, I want to share with you some history. So as far as the employer contributions, since 17-18, the district, the employer, has budgeted $111 per employee per month in combined increases. So from $329 to $440 per employee per month. And I'll have an illustration to show you a little later on that. As far as the employee premiums, spouse and dependent tier increases occurred in the year 1819 and 1920. And those increases range from $35 a month all the way up to $128 a month. The key thing to point out here that it was the spouse and dependent tiers only. And again, I'll show you an illustration on that. There have been no employee-only plan tier increases since the year 1011. And the majority of our employees do participate in employee-only tiers, about 70% of them. As far as reducing our expenses, there's been several cost containment strategies that we've implemented over the years. We've had for several years now 2 employer-specific pricing arrangements with 2 local primary care physicians. That benefits not only the plan but the employee, because the employee gets the benefit of a reduced copay. The plan gets the benefit of an additional discounted pricing that ultimately, obviously, the district pays for. So we feel it's win-win to have those 2 arrangements. Additionally, about January 21, we implemented a mail order program for certain targeted medications to be filled internationally. It's primarily from Canadian pharmacies. It's a select list of drugs, and it is on a voluntary basis. I'll talk a little bit more about that also in a subsequent slide. We had a disease management program. We recognized that many of our members are diagnosed with diabetes, and so we implemented a diabetes management program a few years back. We also implemented reference-based pricing, and that's an opportunity for not only the plan, but for our employees to benefit. Depending on the providers they choose, potentially they could have no out-of-pocket expense. So that's been implemented a little over a year ago as well. And lastly on this slide, telemedicine. Even before the pandemic, the district did have a telemedicine component to its health plan. Again, this is a win-win because the employee does not have to pay for that telemedicine visit with the physician, and the employer or health plan does not get a balanced bill from that provider. So it was win-win. We are looking at some enhancements of this particular benefit through a new vendor, Access, and a couple of the key enhancements are that this new vendor has more of a concierge approach to telemedicine, whereas the current vendor, it's a pool of physicians that answer the call randomly. This new vendor will select a specific number of physicians to always answer the calls from our employees. So it's more of a concierge level. It allows for the opportunity for employees to actually develop relationships with those physicians to the point where this particular group even promotes chronic care as part of telemedicine. Our current vendor is strictly for the minor colds, flus, allergies, those kinds of things. This particular vendor goes beyond that and is willing, obviously with patient consent, to go beyond that and actually treat and consult on chronic care. Diabetes, for example. If somebody has diabetes questions, they can use that service to help them manage their condition. That's just one example. Next slide, Mr. Moore. So as I shared earlier, this is a slide that illustrates the premium and cost history. So that blue slide at the top, that represents the employer. As I shared earlier, between 10-11 to currently, the rate went from $329 per employee per month to the current $440 per employee per month. Most of those increases occurred in the 17-18 year, and there's been an increase almost every year since then as far on the employer side. The employee side is represented by the other two colors there. So the black dotted lines, or yes, the dotted lines, that represents the tiers I referred to that the spouses and dependents received the increases. So in the years 1819 and 1920, adjustments were made to the premium side of the benefits for those tiers. The other thing is the red there. So that red represents the employee premium. So as you can see, it's been flat since that first adjustment in 10-11 of $22. So from 11-12 to current, there has not been an adjustment to the employee-only tiers for all that period of time. Next slide, Mr. So real quickly, this is also a slide from a prior presentation. It's just a comparison. We typically compare ourselves against some of the school districts. As I shared last time, in terms of the deductibles and the maximum out-of-pocket, our plan, it is very competitive. As you can see there on the right, the numbers in parentheses in red represent how we rank against these other school districts listed here. So we're pretty strong in deductibles and out-of-pocket. In terms of prescription, we're very strong. Our copays are some of the lowest compared to these school districts. When it comes to the actual cost, and by the way, these are base plans. So school districts can have more than one plan. This compares their entry-level plans. So these are base plans. In terms of cost, our plan is kind of all over the place. So some tiers is competitive, some tiers are not. It's kind of a mixed bag there. And the last thing there is employer contributions there on the last orange row. So in terms of the employer contributions, how do we compare to what other school districts are contributing to their self-funded programs? So we're currently at 440. That puts us at number 3. So there's 2 others that are contributing less, and the rest of them are contributing more. So we can look at that 2 ways. One, we've managed to keep the employer costs down low while not adjusting the premiums. As I shared with you, there hasn't been significant increases in premiums. The other approach could be that our contribution as a district hasn't been as much as others. So other school districts have been able to contribute more, maybe because they needed to, but they've been contributing more into that fund. Next slide, Mr. Ron. I think we lost the connection. There we go. So now let's talk about what our plan looks like for next year. So this particular illustration shows if the district did nothing with the current funding and the current benefits, no changes in either. We're looking at about $25.6 million in revenue, with expenses projected out to be about $28.8 million. So for the year, that would be about a $3.1 million in the red. We do expect to get some rebates, so we projected out about 75% of those. So when those come in, obviously that offsets some of the expenses. But even with $1 million of projected rebates, there would still be a loss for that year of about $2.1 million. Now, that $2.1 million is the equivalent on a per employee per month basis of about $53. So that's going to be important as we go to the next slide. The last note here is that assuming this particular scenario with the loss of $2.1 million, that would bring our fund balance as of 6/30/2023 to just over $2 million. Next slide. So what are we recommending for 22-23? So administration is making 3 recommendations for the next plan year. The first one is shared funding, and I'll go over what that means. We're proposing a cost containment strategy related to international pharmacy, and then we're proposing a spousal surcharge. And again, I'll cover that here in a bit. So as far as the shared funding, I shared that $53 per employee per month is the funding gap. So we're recommending that funding be shared 50-50. So the employer, the district budgets an additional $26.50 per employee per month. So that would raise the contribution from $440 per employee per month to $466.50 per employee per month. The balance, the $26.50, that would make up the total of those $53, would be adjustments to employee premiums. And that could be done in one of 2 ways. We can distribute the $26.50 across all plans, across all tiers, regardless of whether it's an employee-only plan in the base or the family plan in the state plan. So that's one approach. The other approach is to develop a strategy that distributes the same $26.50 more in an aggregate distribution. So I'll show you what that looks like. It would mean about 13 per month, an employee-only tier, all the way up to $115 on our highest family plan, and I will show you what that looks like. Right now, we are recommending the option 2 that distributes it across the plans and the tiers. The second cost containment there, international pharmacy. We've had 1 year's worth of data that we've had benefit to. We've seen some significant savings by filling prescriptions from Canadian pharmacies. It is currently voluntary. Because it is voluntary, we're not getting the kind of participation we would hope for. A savings report suggests that there's an additional $785,000 in savings if we were to move that program into mandatory. What does that mean? That means that anybody who has currently filling a medication that's eligible to be filled through this international pharmacy program, they would now be required to do so. There is a benefit to them. The copay is waived, so currently they're paying a $25 or $45 copay. By switching it to the international pharmacy, that copay is waived. So there is a savings not only to the employee, but a significant savings to our health plan because the cost of those medications are $50, $60, and sometimes more as if they're being filled domestically. So we're recommending that we move that program to mandatory. And the last item here is one we've talked about in prior years. It's a spousal surcharge. So because traditionally school district health plans are very competitive in terms of cost, there is opportunity for spouses to enroll in our plan, even though they might have access to benefit plans through their particular employers. And so while we recognize that our plan can enroll spouses, we also recognize that that's an additional liability to our plan that could be with the other employers. So we're proposing to put in a spousal surcharge. So this would only be for those spouses that meet the criteria, and the criteria being that they have eligibility through another health plan. And there'll be a process we would go through to get that information, and depending on their answer, they'd be subject to a $100 surcharge if they elect to continue on our plan or to enroll in our plan. If they elect to disenroll, well, obviously, they wouldn't have that surcharge. So that's the third recommendation we're proposing. Let me show you the illustration. Next slide, Mr. What would it look like with those cost containment and additional funding? So that first line up there reflects $27.7 million. That includes the $56 per employee per month, $26.50 from the employer, and the $26.50 from the employees. The second number there is the expenses, so this is reduced already by an estimated $785,000 in savings from the international pharmacy. So in the year, that would mean a loss of $271,000. Now, as I shared earlier, we still would expect rebates, so when we factor in the rebates, this projection would show that the fund would be in the positive at the end of next fiscal year by $778,000 approximately. Assuming that number, the fund balance would be estimated at $4.9 million at the end of 6/30/23. Next slide, please. So this is the illustration about the scenarios for raising the $26.50 for employee premiums. The illustration there on the left is option 1. So option 1 is $26.50 across all plans, across all tiers. So regardless if you're in the employee-only base plan or the state plan, family plan, it's the same $26.50. So there's an advantage to that everybody shares in the amount equally. However, we're recommending option 2. So that distributes the equivalent of the $26.50 across the plans and the tiers. So as you can see, if you're in the basic employee only, that'd be a $13 increase. Going up to the high plan employee only, it'd be a $18. Need my glasses for that one. Bear with me. $18 increase, and then all the way to the state plan to $23. And as you can also see that depending on whether you're in the base, high, or state, that number is slightly higher for the richer benefits and for those tiers that have spouse and or dependents as compared to the employee-only plans. This more fairly, in my opinion, distributes the increases than if we do a straight across the board $26.50, because $26.50 would apply the same increase regardless of whether you're in an employee-only plan, which, as I said, is about 70% of our employees. Using this particular census, that's 1,796 employees that would be subject to $26.50. While using option 2, those same 1,796 would be subject to a $13 increase. So a few key dates. This process always happens around this time because of the employer contribution. That all has to be decided as part of the budget process. So that additional $26.50 needs to be built into the budget. As far as the other cost containments, those would not happen until January. So when we talk about employee premium increases, those coincide with the plan year. So the plan is January 1st. Same thing with benefit design changes, such as the switching from a voluntary to a mandatory program. That would happen on the anniversary date, January 1st. Same thing with the spousal surcharge. So there's still more time, obviously, to educate and give the employees the opportunity to look at what's potentially changing. That doesn't happen at the same time as the budget and fiscal year changes. The other things to keep in mind is that we're currently in the third year of a 3-year agreement for both our pharmacy group contract and our medical group contract. So effective January 1st, 2023, there'll be new contracts. Whether or not it'd be the same providers, obviously that remains to be seen. We're going to go through an RFP process and ultimately come forward with a recommendation, but there'll definitely be new contracts effective January 1st, 2023. And that concludes my presentation. I'll be glad to answer any questions you may have. And as I said, Value Risk Consulting is here to help me if there's any questions I can't answer for you.
Thank you, Mr. Silva. Any questions, Trustee Suarez?
So I'd like to start off with the last question, or the last statement you made, is that there are new contracts going up in January. Do we anticipate any kind of price increase depending on what vendor we use, or does the price stay the same?
So it's difficult to gauge whether we're going to see an increase. Keep in mind what we look at from the perspective of administrators is usually administrative fees.
Right.
That while we have to really look at their level of discounts with the medical providers, it's my understanding that there's more of a level playing field now, and we probably can't expect to see a whole lot of fluctuations, so the kind of level of discounts we're seeing now is probably what we can expect going through this process. Where we think we're going to see some strong, if not stronger, opportunities is on the pharmacy. Those rebates, if you remember from 4 years ago, when we did that process, this transparent model, those rebates were considerably higher than we had seen in the past. And so now that's our expectation. Our expectation is that we get at least those kind of rebates or more. So vendors will no longer have the opportunity to maybe hide some of those things from us. We know what's available to us, and we're going to expect those same kinds of things. So I think we're going to have some good opportunities as far as the pharmacy contract.
So there's a chance that we might be able to save some money.
We'll be able to generate more revenue. The savings comes with the cost of the prescriptions. The cost of prescriptions, the trend is going up, but we have to implement some of these strategies, such as the mandatory program through International Pharmacy, because that's where we're seeing the lower cost medications. So by doing that, in addition to rebates, those two things would definitely help our plan.
Okay. I want to start off at the top. I want to go back now to the beginning of the presentation.
Yes.
You said something that's very interesting, and I'm just wondering if we've done our part in due diligence to let our employees know this. You commented that from 2011 to 2012, there's been no cost increase to the employee, which means every year that insurance has gone up, the board, even previous to us being on this board, has made it a point to make sure that our employees do not see the effect of a price increase, which to me means it's an indirect raise or an indirect way of them having to pay, or not having to pay more money, right?
Yes, sir.
So my question to the department is, do our employees know this? Because after this meeting,
Call Marco.
call Marco, which my response is going to be since 2011. I just wanted to get that out there. I'll go to my next question. I guess, I don't know if this is for you or for Valley Risk Consulting, but if I was an employee outside of the district and I were to try to get health insurance, what would it cost me compared to being insured by McAllen ISD? The same exact plan.
So I'll try and answer that, and then I'll definitely look to Mr. Garza to help me out with that. So from my experience with the Affordable Care Act, there's some lower cost plans out there, but with significantly less benefits.
Right, so my question is directly to what McAllen ISD provides to their employee. What would that insurance cost me outside of McAllen ISD?
Yeah, see, and that's a good question. Definitely defer to him to see if he has any actual direct knowledge. My comment was going to be that our plan is very competitive.
I know the answer, yeah.
It'd be hard to get
But I want Roger
this
to,
level of plan at our cost.
Good evening, President Salivar and members of the Board of Trustees and Superintendent Gonzalez, Dr. Gonzalez, pardon me. Yes, and to answer your question specifically, we've dealt with that on a numerous basis, actually with school districts that ask us what exactly does the benefit actually cost. You could actually tag on about 35% onto the premium, the total premium, not just your contribution, but whatever the employee contributes on an individual basis to the total cost. So you're looking significantly for a plan like this, about $780, maybe $900 a month.
okay. That was the only question about that. I want to talk about telemedicine. You said that the district has had it. This is just for employees. I just want to clarify. This is just for employees have the access to telemedicine, right?
So no, actually,
Whole family.
the benefit we have, there's actually two benefits. Since we started ours before the pandemic, it was through a third-party vendor that focused on telemedicine. So it was not tied to our benefit plan, completely separate, carved out. That particular benefit exists, and it allows for employees and their dependents, regardless of whether they're on our medical plan. So use myself as the example. My spouse has coverage elsewhere, so I have an employee-only plan. My spouse can use that telemedicine vendor that McAllen ISD provides me, because I am eligible. And if we had more in our household, they would be eligible as well. So that is one of the things we promote when we're out there providing the information, that it's available not only to you, but to your spouse and your dependents, as long as they're.
So who pays for that?
So we negotiated that as a value-added benefit through an RFP we did on our voluntary benefits a few years back. So the vendor's paying that. The district's not paying anything for that benefit.
So does the telemedicine company refer, let's say, your significant other, she has a pain in her back? Do they refer to the doctor of her choice or to their doctor?
So the current vendor, and that's why I said there's some enhancements coming, the current vendor probably wouldn't even do that referral. They deal with very basic, here's the immediate solution for you, here's your prescription. Then it lets the patient decide what to do next. They will not issue referrals.
Okay.
This new vendor promotes that they'll go beyond just that initial visit. If they need a referral, they will work with the particular, in this case, our employees, obviously, to get benefit through our health plan, they have to be enrolled for the
Right.
referral part of it.
Right.
And they'd be referring within our network, of course.
Now, these doctors that are seeing our employees and their family members, are they local doctors?
So they wouldn't be local doctors. They may have some Texas affiliations because it is a Texas group, but they wouldn't necessarily be local.
Okay, and then the last question about the international pharmacy, you stated that if you go with international pharmacy, that the employee, the copay is waived. Who absorbs that cost?
It's absorbed by the savings that we generate by the lower cost of the prescription. So we're still paying the cost of the prescription. So the way the process works, normally, there's a copay that, the pharmacy would benefit from. But now, that is absorbed into the cost of the savings.
So is that an incentive for them to do that?
That is the incentive.
Okay, so now if you make it mandatory, what's their incentive now? They don't have an incentive, right? You have to do it.
Well, there wouldn't be an option, basically.
Right.
That's.
But they still wouldn't get copaid, right? Now, what I don't want is to say, okay, now it's mandatory, but guess what? You have a copay.
No, it would still
Okay.
be waived, absolutely.
All right.
In the analysis that was done, that $785,000 in savings, there's about $48,000 in copay savings to the members. And I didn't mention, it's based on the utilization that we looked at, it's 1 year history. There's 290 members, assuming the exact same utilization next year, is 290 members that we're talking about here that would be subject to now filling these medications through the International Pharmacy Program. They have to enroll and get it through the mail. They would save on the copay, but the plan would save an estimated $785,000 in prescription costs.
Thank you, Trustee Suarez. Trustee Peña.
So that sounds pretty cool to me, you've got a way to get your meds with no copay. Why aren't more people enrolled in it? What seems to be the issue there that we have to now go mandatory or
Excellent
would recommend mandatory?
Excellent question. And I think the answer is that we're fighting the manufacturers and their incentives. So we've all seen the commercials where they say, if you need help paying your prescription, X company, we might be able to help. And how do they help? One of a couple of ways. You could be eligible for a copay card that is preloaded up to a certain amount so that you don't have any copay at the retail pharmacy. So there's no incentive for them to use the mail order through International when they're getting it at zero cost at the retail pharmacy. If it doesn't pay the full cost, could be a reduced cost. So it's up to a certain amount. So that is one of our challenges, that if you have an option to get it at a low cost or zero cost locally, you're not going to consider enrolling in the program to get it internationally. So the next step would be to go this route.
So then if we make it mandatory, there's no choice.
There'd be no choice.
Trustee Peña, can I give you a personal?
Yeah.
So my oldest daughter is enrolled in this program. when I first sent the information, when it was rolled out voluntary, I sent it to her, she didn't call. It's a little complicated in the sense that, in her opinion, to call, and get the prescription sent to her. It's easier just to go to CVS, what have you, and get it filled. However, when I did call for her, they were extremely helpful. As a family member or anybody of her, I was able to make the phone call. They helped us getting the prescriptions sent to them. It was due, and so they contacted the provider. They mailed it to her house. They waived the copay, which was pretty significant on this particular medication. And so now she's enrolled in the program, and now it just comes with no issues mailed to her directly. So there is a good program. It's very easy to follow. The instructions, they have support staff in English and Spanish, and y'all send out a lot of information. In fact, the reason that I knew about it is y'all sent something about waiving copay, and I know she's a teacher herself in Austin, so there is a little impact as far as the copay. So I think they'll like it. You just have to send out all the information again that you did initially, and I think there's going to be some initial curve to it like us, but once they get onto it, it's going to roll smooth.
Okay, that makes sense. And then on the spousal surcharge would be $100 for the spouse more a month, right?
In addition to whatever the premium is at the time. So, we're proposing some increases there, but it'll be $100 in addition to. But that's only applicable if, obviously, they have an opportunity to enroll through another plan.
Oh, okay. Thank you, that's all the
Trustee
questions.
Benny, can I, because I want to answer.
Yes.
It's a perfect segue to another one, because I'm that person.
Okay.
So I have a qualifying insurance with my company, and then obviously my wife's a teacher, right? I don't use mine. I have a high deductible, and I'm with an insurance company, which is ironic, right? The health plan of the district is so much better, and the family plan doesn't charge me. It's a common standard that it's always charged. So in other words, if it was a private sector and my wife wanted to come over with my insurance, they would charge her. And it wouldn't be probably $100, probably more. So I think this is a good move. It's going to take me out of it, which is perfectly fine because
Oh, man, I wanted your $100.
I know. Well, no, I don't. That's just it. You don't. Oh, I see what you're saying. But if you have a surcharge, I don't pay anything. You shouldn't pay anything additional to it.
Right.
And there should be, because then you're assuming my risk. So, and then a single teacher's pay, for me or what have you, it's just the right move for our district, because then it's going to make me go back to my insurance and not have the district, which is a great plan, by the way. I mean, let's be honest, it's a really solid plan. So anyway, good move on it. Sorry, Mr. Suarez, I'm not going to pay the $100. I'm going to go back to my insurance. So.
Trustee Alvarado, you still have the floor if you have any questions
No,
at this
I
point.
think the only other comment was, I know the scenario 2 is a good scenario, and I think Dr. Gonzalez, from my standpoint, it evens out, where everyone assumes it, and it's not just on certain segments that are paying, for our insurance. It's everyone has a share. Unfortunately, cost of insurance has gone up, and I think the district's done a really good job of keeping our costs down. So. And hopefully this coming year, I think I've seen the workshops, we are looking at a pay increase also, so it's not gonna be just a charge. We're probably gonna, at some point, I know we were gonna talk about that here, and so I think we're trying to be as fair as we can to our teachers, so I like everything that's been presented.
Yes, sir.
Thank you.
Trustee Penny? Okay.
It-
Trustee Vella?
If I may, related to, I did a quick analysis along those lines. The majority of our lower paid employees, if you will, are not even in the plans that have the highest increase. They're an employee only. So
Yes.
their increase, assuming they stay in that plan, would be probably in the $13 range
Awesome.
Per month.
per month. Yes,
Yeah.
sir.
Thank you. Trustee Vella?
Thank you, Mr. President. For Mr. Silva or maybe Mr. Gonzalez, I know we were talking about the international plan, and you sent us a list of the drugs that are on that plan. I think everybody got a copy of this. And there's some things that come, there are a lot of Me Too drugs on this plan, which means there are a lot of drugs that could accomplish the same health benefits. Have we looked at modifying our formulary at the PBM level, maybe to eliminate some of these higher cost drugs?
So that's actually something I tasked them to do here recently, as we were going through this process. So what else could we do to tighten up this this list. So they're currently doing an analysis for us on
Okay.
that.
And I think, Mr. Alvarado, in answering trustee Peña's question about the prescription and the international plan, how do the patients get the plan, the prescription to that plan?
The prescriptions,
If I go to the doctor and get a prescription?
Yes.
How does it get to Canada?
so one of two ways. If you have it, you send it in. Otherwise, they will contact the provider and request it, and it gets sent to them.
So the patient can fax it or
Yes,
send it or whatever?
absolutely. If you have it, absolutely.
You can take a picture also, and text it to them.
Yeah, because the law in Texas is a pharmacy can't fill a prescription unless it comes directly from the clinic. A patient can't bring it in, I was just wondering. And also, there's some asterisks at the bottom of this list that they won't ship the medicine until, I guess, the district has paid in full for it? There's a few drugs that says, this medication will only be dispensed as a 1-month supply due to the high cost of the medication and must be paid in full before shipping.
Yeah, so that relates to, so yes, we would pay for that, and that's actually a process that is already in place. So periodically, depending on the drug, if it exceeds certain thresholds, they send me a notice that said, we reviewed it, it's gone through the processes, you approve it, yes or no. So those particular ones, if I'm not mistaken, and Mr. Gossett can probably elaborate on that, were the ones that had such a high dollar that we elected not to have them filled beyond a certain amount because we had seen, or at least to prevent any kind of spoilage type issue or issues where prescriptions are changed in dosage and something had to change where we might be out, a certain amount. So I think those are the notes that's what that relates to.
No, it says paid in full before shipping. But that happens a lot with 90-day supplies. Patients get changed
Yes.
way before the 90 days is over with, and it goes to waste.
Yes, and that's what we're trying to address, but it did just target a select of the higher cost drugs. It wasn't across the board.
Okay. And then there are a lot of drugs on here that are Canadian-only drugs, it seems like. Does that mean a physician here could prescribe a Canadian drug to be brought in?
So that's a good question. I'm not being familiar, obviously, with all the drugs. We did have one scenario that came up where there was conflict between what's available in U.S. versus what's available in Canada. And what was available in Canada, in this particular example, it happened to be an injectable in different dosages. So what ended up happening was the drug's available, however, the member, instead of getting 3, for example, syringes, they had to get 6 because it wasn't available in that full strength. So that might be some of those scenarios, but I'm aware of that one situation where it just didn't match and there had to be some adjustment.
And who pays for the shipping?
So the shipping is paid by us, the employer. It's built in. So we get a bill that says on a weekly basis, these are the drugs that have been filled. Here's the shipping cost for each, and we fund based on that.
And I guess they're shipped refrigerated for those that are cool,
Correct.
and they charge us extra for that as well?
They charge extra for that, and they go in special containers.
Yeah.
We haven't seen a problem. That was one of the questions we had early on, because apparently these are very expensive containers, and the responsibility is on the employee member to return it. We haven't had any issues. Either we haven't gotten to filling those kinds of medications, or employees are complying, and they're supposed to come pre-prepared to ship back. So we haven't had any issues where anybody in the district has incurred additional for containers not being returned.
Okay, thank you. And then just back to the $26, I mean, I know it's $26 a bump a month from going forward if this gets approved. If we'd done $2.65 every year over the last 10 years, we'd be right here where we are today. And maybe in retrospect, we should have, so that we wouldn't have a fund balance that is in the situation that it's in today.
So excellent point. Probably should have showed the illustration on fund balance. In the years that we didn't have any adjustments, our fund balance was pretty healthy. We started adjusting the employer contribution when that fund balance started showing that dip. And so that you can see that in the trend there. So in those years where we didn't have anything, there was actually excessive fund balance.
If my memory serves me right, I think we got to 7 million Ms. Richards,
I
with
think it was 9.
9
9
million at one
million,
point.
yeah.
And I think we even talked one year about giving a free month or something
So-
at
so-
Christmas time to employees.
So if I'm being transparent,
Please.
that was part, hindsight 2020, that was part of the problem.
Yeah.
We got up to 9 million. We felt comfortable that, hey, you know, the whole point of a self-funded program is not to keep a $9 million fund balance. As it stands right now, the recommendation is to have about 5.8. So at 9 million, we almost had twice as much, and it would have been a less of a number we'd had to maintain. So we actually started waiving co-pays in December. So if you recall, we had a premium waiver holiday. We did that a few years. That was to cost about $500,000 in each of those years. And then we had 2 or 3 years straight where we gave an incentive for employees to participate in the flu vaccine and the biometric screenings. So both of those were felt that, you know, it was to increase participation and let's get the incentives to get them out there. But then we started seeing the cost of medications go up and the cost of our medical expenses go up. So we kind of had to regroup and kind of rethink those strategies, and we stopped those, and we haven't had them since.
What's the total med cost right now? Annual? I know it used to be about $5 million.
We approached 6. I think this year we are trending to be at 5.
Well, if it's down to 5, it's.
Yes,
it's
because
on
of the
way.
rebates.
Well, but still, I mean, we were lucky to keep it at 5 several years ago.
So let's
So
see.
you're saying that the cost of the insurance is not because of the meds?
Right now, what we're seeing is our medical plan is the one that is having the increases.
Not the medication?
Not the medication. We've been able to kind of stabilize it. We approached 6 million 2 years ago, and then we're hovering right at the 5. Yeah, so no, while the cost of drugs are going up, the rebates, the international pharmacy had an impact this year. We were able to kind of stabilize that trend, but the medical plan is where now we're seeing the increases.
All right. Thank you, Mr. Seula. Thank you, Mr. President.
Yes, sir, Trustee Valen. And Trustee Farina.
Mr. Silva, I want to look into the future. You said that the contracts come up in January. How are we looking? Are we something where we're going to get a little more competition? We'll have some other groups that are coming in and saying McAllen ISD has done so well that we actively want to participate and maybe even challenge the current providers?
So on the medical plan, there's only a few that we can expect, 2 or 3 of the bigger groups. When it comes to insurance groups that serve as third-party administrators. In terms of TPAs, I understand there might be 1 or 2 that we can expect to have lower fixed costs, so lower admin fees, but then we're going to have to look really close at their networks because it's not their network. They're renting it from another source. So unlike the big insurance companies that they do their own negotiation, it's their networks. There's some TPAs out there that rent them. So on the medical side, probably won't see too much more than we have in prior years. I'm hoping on the pharmacy side we will. There's been a lot of interest in the last few years. Interestingly enough, we're getting some marketing type campaigns of programs that are saying out there that they have international pharmacy components that can save us money. So there's more of that that's coming our way. They're promoting, you know, rebates and transparency, which is what we're hoping to see. So on the pharmacy side, I'm hoping to see more competition. And as I said, I think we can expect to not do any worse, which I think is saying a lot that we're going to do fine on the pharmacy side based on what we've already experienced. The medical side is probably going to be just as tough as it has in other years.
Okay, sticking with our pharmacy side, the subscribers that we have we even polled them about the voluntary to mandatory switch? Has there been any sort of discussion? Is this something that we can, you know, honestly say, hey, we've talked to our members and this is what it is that we're looking at? Or would it be a total surprise when we say it's no longer voluntary, this is something that you're going to have to do mandatory now?
So not polled. I will tell you that part of the campaign that I did when I was out there on the campuses, that was my message. That this year we're going to be looking at how well we're doing managing our costs, and shared with them the international pharmacy and encouraged them that if they're getting the letter to participate, that we'd be looking to see what kind of strategies we would need to do up to and including increasing our rates. So kind of getting the message out there that the more we do as employees my message was, help me help you. You know, the more you help me, then when I come here, less likely of an increase, let's lower the increases. So we haven't polled them, but the message was that we need to do better, and if we can't do better, then things were going to change.
And how's that vibe been? What are you reading on that?
So if I can be perfectly honest,
No, lie to me, Andy.
I thought it was a given when we came in here that we were honest.
Tell me I look slim all of a
Just
sudden.
I get the blank stares. Like, okay.
So we still have to do some more educating on the international
I
pharmacy.
think we
and-
always need to be educating, and we do have a lot of efforts we do to educate. We even tried to get surveys, not poll, but we did do a survey, not a whole lot of participation in it. So everybody who got a letter that says you're eligible, get an opportunity to tell us, I've heard about this program, I'm interested, not interested, I'm not interested for this reason. Very, very little participation. So I don't have a gauge for why they're not engaging in those. There's 3 questions, but they're not following through. Yes, we always need to do more and more to educate our employees.
I would try reaching out to the professional organizations that we deal with already and just say, this is something that we'd like for you to ask your membership. Maybe we'll get something, a better result through that tactic.
That's
Yes,
what
sir,
I was
Mr.
gonna say.
We can certainly do that.
I'm sorry. So we've had Andy to the JPCC meeting, talk to the teacher groups at least, I'd say at least twice for sure, in the last 12 months, and talking through a lot of the same information, and to include the international pharmacy and what you can do and how it can save you money. So I know he's been out there on campus visits also, so.
Awesome. Thank you.
Any other questions from the board? When it comes to medical concerns and issues, that's very, very personal. It gets magnified when it's a child. We all know that. So when it comes to these conversations, you've identified the individuals that are on these maintenance medications. That's really what we're talking about here, maintenance medications, correct?
Yes.
Okay. So these are individuals that have gone through a series of trials, and the doctor, their attending physician has culminated that the patient responded well to this drug. And it happens to be one of the ones we're talking about here today with the international pharmaceutical. Have you had one-to-one conversations with those individuals and shown the comparison? I'm sure you have, but I just want to be sure.
So we actually stray away from doing one-on-one conversations for privacy reasons. We rely on our third-party administrators to do those communications.
Okay.
It's not that we can't. We can certainly revisit that approach, but even though we do campaigns that we're self-funded and, it's our plan, we're paying the bills, all that kind of messaging, I think some of our employees still don't recognize that we are a self-funded program. So having that one-to-one conversation might be kind of a shock to them. So why do you know about my particular
I hear you.
pharmacy situation, my particular, illness? So we purposely shy away from that. That's not to say that we can't maybe find a middle ground where, as part of the education campaign, to continue getting the message out that, we as the consumer, being a self-funded health plan, we're all part of this one group and this one pool. And the more we know about it, the more informed, the better for everybody.
I understand. You have something to say?
I just wanted to make one point, now that we're talking about communication. I did want to commend Andy. He did come onto the Super Talk, our podcast, and talk about all aspects of employee benefits, and we did have 21,000 views. So we did get a lot of traction on that, and we'll continue to do that. But Andy has been across the district. He's been doing his very best, and will continue to do that.
And again, I think our questions are not, in fact, these are, I've been on here for a while, you're always forthright. I know you use that phrase, if I could be, you've always been forthright and honest, and I really appreciate that, and that's why I said it's a given, and it is. And you've been very candid, and even in this answer and this question, because as I preface, it's very personal, and hence you verified that, because it could be misconstrued that as the provider, i.e. we provide the service, it could be construed that we're trying to diminish the medical needs that they have at the benefit of the plan, and that's not what you're trying to do, and nor we are trying to discuss here today. So I appreciate that answer, and I thank you for being candid, as you always have been. Have we talked about grouping? I know in the past we've had this conversation, it could be, maybe, possible, help me remember, about maybe with the city of McAllen or another school district. Is there any benefit to that or any possibility to doing something of that nature? Or really, it's a no sum? All you're doing is increasing membership. It doesn't save you anything, or it doesn't gain you any momentum on any further discounts.
So we did explore that with the city. We had several conversations. I met with my counterpart over there. They had some internal discussion, then we met again. The consensus seems to be that it'd be hard to agree on one pool of benefits for us to be able to benefit from that. So while pool arrangements, you know, they are out there and they could lower cost, you have to have one pool of benefits. So we would both, I think, take the position that, no, we like what we have, and we'd like to keep it. And they're going to do the same thing. So that was one issue. The other issue had to do with underwriting for stop-loss insurance. When you have two different plans, also difficult to do. When it comes to these providers, you know, the networks and who's in and out of network, all of those things are, it just didn't seem like it was something that would be a good, smooth approach. So while we had the discussions, they didn't go very far.
Okay, fair enough. And as far as the cost that we were talking about, if we went with scenario B, is what you have, is B, right? Or
Two.
option B. You mentioned it'd be $16 and change, but that's an average. It'd be different for different folks. But most people, it'd be $16 per month. Am I reading that right?
So it starts at 13 for our base plan, employee only. All right, 13 base plan, employee only. That would be the lowest increase. And then in the highest increase would be in our state plan, which is our richest plan, in the family, which would be 115. So in that range,
Per month?
per month, yes, sir.
Okay.
And as I shared with you earlier, the majority of our employees would be in that $13 per month because the majority of them are in employee-only basic plan. So using this particular census, it's 1,796 of those employees.
Gotcha.
Versus that 115 figure, based on this census, currently there's 8 people that would fit in that particular. Now, the other thing to point out is that they have options to make changes. So, for example, in that scenario where it's 115, if that's too much, they can move to a family plan in the high or a family plan in the basic plan and reduce that increase. They still have options during our annual enrollment period.
Gotcha.
They can take out their husband.
They can take out dependents.
Thank you. I don't have any other questions. Any other questions from the board? Hearing none. Thank you for your presentation. Have a good evening.
Thank you, Mr. Silva. Sir, thank you.
You can take my family off that. the 18 I'll tell my wife.
Wow. You sound upset about it.
No, I think it's great.
Sound-
All right. We just covered 5A.
Aloha, Roger.
All right, take care. We'll go back to item number 3, which is discussion of request for qualifications 2023-1000, General Legal Counsel Services. Dr. Gonzalez.
Yes, sir, Mr. President. The Purchasing Department, along with the designated committee, have been tasked with preparing a new solicitation packet for general legal counsel services for the district. And together, they will collaborate on the scope of work for this RFQ. We have Ms. Alejandra Gonzalez, our Director for Purchasing Services, who will share more information, and this item is for information purposes only. Ms. Gonzalez.
Hi, good evening, Superintendent and Board members. I have a brief PowerPoint that I'm going to go over just to set the groundwork, and then we can discuss the packets that you received. So basically, the participants, in terms of this solicitation, the board would be our end user, so y'all would form the committee. Purchasing would serve as facilitators. I have my team with me here. I have Liz Cabrera and Crystal Mercado, and we would facilitate it for you with all the procurement documents. That's the tentative schedule to advertise this coming Wednesday, which means this is the period to open it up for vendors to begin submitting. The second ad would come a week later. And then we always do the last questions where they can ask any type of questions that Friday before it opens. And we do it on that Friday to still give them depending on what they ask, because we require that they ask the question online. So depending on what they ask, it still provides all the other vendors enough time to still submit by Wednesday in case they want to update something based on the question that was asked. And then after that, so that the process will close on April 20th, and then having a board workshop on number 2 on April 25th, and then having a special board meeting for interviews and selection of award on May 2nd. Now, this is flexible. If, after tonight, we can determine if we feel ready to release on, we have submitted the ad. You have to submit the ad with the monitor the Friday before to submit, to release it to the public on Wednesday. But if we don't feel we're ready, we can always cancel the ad and push it off for a week if that's the direction that the board decides. So quickly, the procurement process is for the board to determine the best method to procure. One of the things about this particular one, it's legal services. So legal services doesn't quite fit into either Texas Education Code 44.031, which is the majority of our procurement law, and it also doesn't fit into Texas Government Code 2254, which is professional services. So what TASB Legal recommends is that the board determine the method of procurement. Historically, the district has done requests for qualifications, which is RFQ. What an RFQ is, it's basically that you are soliciting information for qualification statements. So the vendors need to be competent and qualified, and price doesn't come into play when you do an RFQ. However, the board is able to determine that they want to do an RFP. So RFP means request for proposal. The difference would be that price would come into play. And because legal services doesn't have to be under 2254, which requires us to do an RFQ, such as with engineers, architects, then it's up to the board to determine the method. Historically, we have done an RFQ in the district, but it is completely up to the board to decide if that's the method. And as far as the documents are concerned, it'll be very much the same thing. We just changed the terms. The template would be changed to proposal versus qualifications. And then, of course, the evaluation matrix, which you do not have a copy of, but I'll give you one on the proposed one for now. So, the solicitation needs to be posted, the ad needs to be posted 2 weeks in a row by law. And so that's what we're saying, the 6th and the 13th. Registered vendors will receive notifications. We have a lot of vendors that are already registered on our bidding portal. We've had this bidding portal, it's an online software that once you're registered, it sends you notices if that's your commodity code that you registered for. So that's how we would plan on reaching out to the majority of the vendors. The system would automatically generate it. In addition, we would go back to our old system, which was public purchase, pull out the emails from there and send them an email, old school, basically inviting them to submit. Anybody that's not registered would need to register to be able to view the documents online. And we've been doing this process, which creates a lot more efficiencies for about a year and a half now, since November of 2020. So anybody that's not already registered, we will pull them from public purchase. And of course, anybody invites, if they email us and ask us to if they can participate, we'd give them instructions on how to register on our portal, and then they would have access to the documents. And then electronic submissions would be accepted. The beauty of this new portal is that it tabulates for us. It makes our job a lot easier versus the hand reading everything. And we have to read everything, but it just tabulates for us. So we're very happy with this program. The procedures, so the board members would be the sole members of the committee. The committee members, y'all would need to completely abstain from all communications with any potential vendors. So anybody interested, the moment this goes out, if we do Wednesday, you can no longer communicate with anyone. If they ask you questions, you need to refer them to us. And that's the way we handle all types of procurement. During that open period, there's no communication whatsoever. You would just direct them to us, and then we would, and typically, if it's a technical type question that they're having trouble logging in, we would guide them on the phone. If it's a question that has to do with the actual solicitation, then at that point, we would ask them to post their question on the portal, because we don't want to have anybody with an unfair advantage. If we're answering a question for one vendor, they all need to hear that answer. So all questions are posted publicly for all vendors to see, unless, of course, it's a technical difficulty that they can't seem to log on, there's a password issue, that's completely different. But if it's related to this, then we would be the ones answering those questions only. You would just, if they contacted you, you would refer them to us and we would handle it. A committee leader amongst y'all is recommended, it's not required, but it's recommended. We will facilitate the procurement process. And y'all have by now received the whole packet, that it's a draft version. It's pretty close to what we thought was in a good position, but once y'all review, and I'll tell y'all a lot of it is procurement language that is not, it's standard. So, and I'll, when I finish the presentation, I'll tell y'all where to look to make it easier for y'all. The evaluation ranking must be performed on the basis of whatever we publish. So whatever we decide, the vendors will know right away the rubric. How do I get the maximum points? It needs to be upfront. And then when we reach the point where we're going to interview, what I'm going to request from each of you is 2 questions from each of you, so that these will be the interview questions. And we will, once we have we'll have the board workshop, the second one, that's when y'all will give me questions. And then when we go into interviews, the board will decide how many people you want to interview based on whatever we receive. And at that point, we would stick to those 14 questions, basically. And y'all would ask the vendors the exact same questions, so they can be apples to apples. And that concludes that. So, questions so far before I get into the packet?
Any questions from the board?
Trustee Suarez.
Trustee
Yes.
Suarez?
On the first slide, you talked about how there's a difference between, well, when you go off of the RFQ, that there's questions that can be submitted by the vendors. Is that generally what you do with any?
Absolutely.
So that's, nothing's changed. Okay.
When we have any type of solicitation, we have the end user, whoever that is, this time it's you, we would have you sign a non-disclosure form. You're basically attesting that you will not communicate with any vendors.
No, but that's not what I'm talking about. I'm talking about, it says that there's questions that could be asked
Yes.
by the vendor.
Oh, on the portal, yes. So
Yeah.
a lot of times they'll ask us questions that maybe it's not real clear to them and they want a little clarification. So we always ask them, post it on Ion Wave. So now it's a public question. And when we answer it publicly so that one vendor doesn't have enough.
But that's done,
For every single project, yes.
okay.
Yes.
Now, my next question is, I just want to talk about RFQ and RFP. I remember at the last meeting, you talked about how this was time sensitive because of the time of the contract and when it lapses. On RFQ, we do not discuss price. So we go through the interview process, the board decides to go with a certain firm, but their price range is way off from what we have budgeted for. So we're back to square one. Why wouldn't we want to do a proposal to where we know the set price and let them compete on the price that we want? What's the big difference between going out from RFQ versus an RFP?
So it would definitely be in the district's best interest to know the price up front. However, an RFQ, if we go that route, it doesn't allow you to do that. And you're right, you would enter into negotiations. And what the law says is that it has to be a fair and reasonable price, but fair and reasonable is subjective. So we're not sure what fair and reasonable could mean. And so then you would end negotiations with vendor number 1 and have to go to number 2 all the way till you got to the end. If you can reach negotiations, you'd have to start the whole process all over. RFP, the price is up front. We could word it in a way where we say we want a base price. We don't want you to bill us hourly if that's what the board desires. We can set a set rate regardless of the hours that they put in, and we could do that. It would definitely be very transparent as to, can we afford this? Is this way out on left field, or is it something that it's reasonable? So Everything else, one of the things that we could do is still ask for their qualifications. We could on the evaluation, on the questions, and I'll guide you through the packet in just a minute, but we ask questions, and based on that, we compare side by side, so we can see what one vendor says, what they have to offer. And then also, we're asking for experience in a lot of areas, so our point system could be based on their experience, of course, with education being obviously the highest one. We'd want somebody that's very well-versed in policy, special ed, all the different types of areas that we have.
I'll yield the floor.
Thank you. Any other questions, comments?
I do.
Trustee Alvarado.
Dr. Gonzalez, how did we get to this point, or why are we making the recommendation?
At this point, the firm that we're currently working with, their contract is coming to an end, and we need legal services. Is it by June 30th?
It ends on June 30th, so by July 1st, somebody in place, yes, sir.
As far as the staff attorney, I'm sorry. Oh, you're not talking about.
No, we're general counsel.
This is generally, yeah,
General counsel, I
general.
misunderstood.
Yes, sir.
Yes.
I have,
It's because they gave us this.
Yeah, so I thought that's we're incorporating on that. No, I have no questions, I'm sorry, sir.
Trustee Peña.
I just have, it's just a point of, if we knew this contract was gonna be over June the 30th, we're in a crunch now. We're like, I gotta get this out by like the end of this week. Why didn't we start this process just a little earlier so that we wouldn't feel this sense of rush? Because this is a huge position. These are the people that essentially are gonna help guide us in making our decisions properly and according to the law. So, I mean, it's not a question, it's just a comment. I'd like for something like this, that's got this kind of weight on it, to be a little bit more, give us a little more time to work with this.
Yes, ma'am. And I take full responsibility for the timing.
No apologies, no, nothing necessary, just a point of, if we got other large contracts that are gonna be this kind of a contract, then let's make sure that we've got enough time to work through that.
Yes, ma'am.
I'm part of the time delay as well. When this was first brought to my attention about 2.5 weeks ago, it was following the normal procurement process, and I reminded the administration, Dr. Gonzalez specifically, we had a couple of conversations, that under the statute, both the two that were mentioned, the Texas Education Code and also the Texas Government Code, it entitles the governing body, which is this body corporate, to decide professional services when it came specifically to attorneys. And so, and it's been long established by law, it's been established by regulations, it's been established by board policy, and by our practice, since I've been on the board, that the board made the decision of the interview process, the questions we were going to ask, and that sort of thing. And so it took me odd that this was going to go similar to the, which I was not aware of until it was already on the agenda, with the other delinquent tax firm. Because really, traditionally, the board was involved in that as well. And so I'm a little taken aback with a couple of the slides, because again, it's long established in law and policy. This body corporate decides if it's to, it is the governing body, and we always function as a collaborative with the established procedures and practices of policy, which means we have a board president, and if I'm not available, the vice president. So that's already been decided. And we decided we want to form a committee. So if we are one and the same, we don't even have to get there. The body corporate is already being established by law as a governing body when it comes to overseeing the district, but very specifically, and it goes item by item under BDD local, that the board shall retain an attorney or attorneys as necessary and serve as the district's legal counsel and representative matters required by legal services. So that's well established. So that's already been addressed. So that was why I said that we need to bring it to the board. We need to discuss it, and that added the 3 weeks that we are today. But I think going forward, when it comes to these professional, unless the board is going to change its policy, we should follow our established policy, which is the body corporate makes these decisions. We have the right to decide the questions we want to ask. We determine the time and place. We make that decision. Unless anybody sees it otherwise, that's been established by law, regulation, and board policy.
Yes, sir.
Sam, can you clarify May 2nd, Monday, just for We're gonna interview, are you planning to do that in the evening or during the day?
It would be up to the board's availability, as we've always done in scheduling. Normally, it seems to work best for the board at 5:30 because of our business schedules, but it's at the purview of the board when you
I
want to do
was-
that.
That's what I was angling for.
It's whatever the
We've done
boards
it during the
decide.
day. Sometimes I don't think I'll be able to get off.
Yeah, then if the board's consensus is we do a 5:30, then we'll do a 5:30.
Okay.
Yes, trustee Alisa?
So, you spoke about the tabulations and the weights. When is that decided? Is that decided by us? Like if I say, section 8.1 references, I'd like it to have so many points. Who makes that decision? That has to go out now, right?
Correct. In a situation like, in a typical situation, we would work with the end user, so this is what we're doing now. So it's basically determined by purchasing, the committee, which would be purchasing, and the end user, and then they determine. Typically, the end user would decide more because they use whatever service it is, and so they would say, well, we feel like points just are way more important, or this little section is just way more important to us, and we just basically set it up for them. So it's always the end user who determines what they feel is most important to them.
But that has to be done before you put this out because they have to know what is important and what they're being ranked on.
So the law does not require that we publish evaluation criteria, except for construction. The law says that for anything else, we don't really have to disclose it. About a year ago, I want to say, Cindy, that we moved toward that, because
Very
vendors were coming up and asking questions, and they said, we want to know up front. So I want to say it was about a year ago that we started disclosing it, just like construction. It's not required by law, but it is,
Best practice.
yeah,
It's transparency.
it's transparency. So this is how you'll be, you want to score 100, this is what you need to do to score 100. So basically like a rubric when you're in school. And so, but not required by law. But that's the direction we moved as a district.
So I think we're all in agreement that's the direction we want to go as far as being transparent. So when will we decide that?
Today, if not, if y'all don't feel ready, once I go over this, yeah, I feel like you might be more at ease.
Oh, okay, go ahead and go over it.
And I do have a sample evaluation matrix for you, and then maybe you'll feel, and it's the one that we use very similarly for architects, engineers, for other areas, and it's got the 9 criteria from Texas Education Code if we route it the RFP, but you can tweak it, because if we route it the RFQ way, you can make it whatever you want. So you can say, no, we're taking that off, taking that. So it's very flexible if we move the RFQ route. If we do the RFP, it would be set. It's set by Texas Education Code. So we just plug in rationale, like where are we going to pull this information? And I'll show you a sample in just a couple minutes. And I
Okay,
think
I'm
it'll.
sorry, I thought
yeah.
you were done with your presentation.
Oh, no,
We should let
no,
you
so I was
finish.
just done with a kind of preliminary.
Well, why
So-
don't we do this real quick? Is there any board member that feels we should go off the RFP route versus the RFQ? Are we in a consensus that RFQ is okay? Is there anybody in favor of the RFP route? Hearing none, looks like we're going the RFQ route.
RFQ.
So we're
Okay.
good there.
And that's what we've historically always done.
Historically,
Yes,
we have done, right.
yes.
But it's, like I said, it's up to the board if we want
For
to
the
take
record,
pricing.
I like RFP, but
Yeah, it's up to the, if you don't want to take price into consideration, the thing is, we can't switch it. So once we're there, if we go RFQ, we can't ask for price. Pricing will not come into play until after you've ranked and after you've said, this is number 1, now begin negotiating the price. So we will go in, you go into it blindly. You don't know if it's going to work out in your favor for vendor number 1.
And for our purposes, under Texas Government Code 2254.003, this means, for what you just stated, this will be the basis of demonstrated competencies and qualifications to be performed as services.
Correct.
Solely.
Correct. One of the things that I will share is when we do RFQs, say for instance, engineers, architects, the majority of your firms are qualified and competent.
Yeah.
So it's extremely tight. So you have to create differentiating criteria. So for instance, perhaps the type of experience you're looking for, that kind of stuff will have to come into play because everybody's going to be competent and everybody's going to be qualified.
So the only difference and the benefit to the district is price. We save money if we go out for.
If we go for RFP, you would see the price up front, and you would say, okay, we already know what we're getting into. So if a vendor comes in, well, we'll charge you $150,000 a year, base cost. Somebody else might come in with 300, and then you have that price comes into play, and the board would decide, well, we would decide tonight, well, we want to give whatever price comes in, 50 points, 50 out of 100. if that's worth 50% of it. If you feel, no, I don't want to do 50%, I can do 30%. We can mess with the numbers at this point. Once it's released, you really shouldn't. It doesn't, you can do an addendum, but it doesn't look good to mess with points. At this point is a good time to say, what do we feel as a board is the most important? What percentage of the 100 is the most important? Is it price? Is it meeting our needs? Is it their quality? So, and I'll show you that criteria in just a minute. And I think once you see it on paper, you'll be able to make a determination of how you want to spread the points. I used to teach, so I like the 100-point system. I think it's super easy. 80 out of 100, 20 out of 100. So it makes it super easy to say, okay, I can get 100 points on this from a vendor's perspective. So, but we can determine that in a little bit.
Yeah, and again, under the statute, it's and. So it's, you still,
Yes,
you
we're
still
still
got to
gonna-
deal
we
with the
still have to be
qualifications.
qualified and competent, yes.
Exactly. But
lot-
more importantly, what your objectives are in your criteria, because they may have varying degrees within their firm. They may not have all. And so that's where the matrix comes in.
Correct.
And then you look at price. And under the price, you also look at the professional fee under the contract may not exceed the maximum provided by law for those services.
Correct,
Okay.
correct,
Those are the key elements.
yes.
All right, does anybody, again, want, Trustee Vela?
I was just gonna make a comment, and I don't know that any one thing is more important than the other. I think when you put all factors together, what we're looking for is the best value for the services that we need. And it can be price, it could be experience, it could be the whole global discussion. What's the best value for the school district, and what's gonna keep us out of trouble at the best possible price? So it takes more than one,
Yeah, oh,
just one thing. It's the whole
Absolutely.
combination.
Absolutely. And when you see it spread out on, and I'll pass out the spreadsheets in just a minute, I think you'll get a good feel for just what we've done traditionally, but we can always change the points to whatever you feel the weights
So are you
Deserve
leaning
more.
towards RFP or RFQ?
Well, at some point, you're gonna have to discuss price.
Do we want to go, though, with that lowest bidder feel?
Well, I didn't say that.
Well,
No, that's what I'm saying. Would we want that? That's kind of the feel I get is, well, we're going with the lowest bidder. Is that really going to serve our needs?
No, I don't
No,
think we
not-
need to go with
no,
the block.
well, and that's when you develop those points, you can say, say for instance, what do you have as a board policy experience in a school setting? And so we could give that a lot of points, and then you could do education law, like, what do you know about that? How much experience do you have? Give that a certain amount of points. Special ed, what do you know about that? So you start weighing where you feel, and then you start, okay, well, we're over 20 points, where do we take them off? And you kind of play with the numbers until you feel comfortable, like,
You work with the numbers, you don't play with the
yeah,
numbers.
yes,
Okay.
yes, sir. And so you're,
Sorry.
to the point
I
where
just
you
want-
feel like, okay, we're getting, it's a good price, but they have the experience. Because sometimes somebody could come in very low, but they don't have the experience, so they're not gonna have the points to carry them to number one either way. So it doesn't matter that they're lowest, because they're not gonna, if they have no experience with anything that we need, they're gonna be getting zeros in that area. So their price will still be lower, but they won't win because of the way the distribution is.
And the way it's worked in the past, since now it's going to be, in the past, it was just the number we interviewed and you put them in order. And it was based on consensus and feel of each board member. And so we interviewed 5. The lowest number cumulative was the one that was first, then you went to second and third. That's the way we've done it. That's the way it's worked for us. And in the past, I think we had 17 or 18, and then we narrowed it down to around 8 or 9, and then from that, we interviewed 5. And we're talking about general counsel. And that was our matrix, that was our measure. And each board member asked a question, and we went on. And that seems to work well. You're dealing with a larger number, with a much more finite thing, that's fine. But the way it would work again is the lowest number of cumulative score, or a highest number of cumulative score, whatever the case may be, of everybody ranking all the individuals. And
Correct.
you'll help us with the tabulation of those.
Absolutely.
To then inform the board, if we go this route, and it looks like we are, qualifications, then we'll have to make a decision in public of what that is, make a motion to that effect, and give a direction to administration as to who to proceed to negotiate for the price. And if that doesn't work, you go to the second and third. That's the way it's going to work. Does anybody have any questions with that, through the RFQ route? Okay. Trustee Vela.
Which is more streamlined? The RFP method, wouldn't it?
Absolutely.
Yeah.
I'm gonna say what Mr. Suarez, trustee Suarez would say, then why are we going with an RFQ if
You're
we're
a
down,
smart man.
if we're down to 60 days?
So,
Like trustee Peña said, I'm just asking a practical question. I'm not leaning one way or the
That
other, but I
doesn't-
don't want anyone to be
My
overshot.
comment doesn't mean that I'm
No, but-
going one way or the other. I just, when you start to think about the weight of this particular position, we want to make sure someone who's competent, qualified, is really there for what we need to make sure that this district continues to be the best district. And if that means we may end up spending a little bit more on somebody, and that's what that means, but I don't want to have that feel that we went with, they were just cheaper and,
Ms. Gonzalez, can you pass out that thing? I think that'll really.
yes,
Well,
okay.
before we get there, though, let me, if I can, I think we need to hear the other piece of this, too, because I'm only hearing one, and then on the next one, we're gonna talk about in-staff. And so, to me, that factors into this as well for me,
That makes
because is in-staff gonna do special ed, or are they gonna do what have you? So that's why I think I was asking my question is, how do we get to this point where on the agenda, I see 2 legal counsel and staff? So I think we need to go to that one, and then we come back to RFP and RFQ. The only problem I have, Sam, is how are you gonna determine which way we're gonna go with RFP, RFQ? Are we gonna vote?
No, well, we can't vote here
I know
today,
we can't,
but we
but-
have a consensus. So if we had, right now, the consensus is about, one of us for sure likes
Now
the.
I'm kinda switching to RFP, that's what I'm saying.
Well,
Yeah.
and that's how you do it, you have a consensus.
Okay.
So as we go through this conversation, and we start to have consensus, and inquiring minds to find a solution, as trustee Vela a little while ago, said, I'm not buying or selling, to use, putting words in his mouth, but he said, I'm just asking.
Yeah.
So now we make the compare, and
I
now we
agree.
start
That's
leaning
fine.
towards RFP, then
That's fine.
there's a consensus.
And why I don't wanna go to this is because if the staff attorney is gonna do a lot, then it's gonna change my opinion on this,
On the matrix.
on the matrix. So I kinda wanna hear that first, and then how, if that's okay, Sam.
No, it's totally right, it's whatever the board wishes to do, I'm not,
And then we come back, we can always come back to this after we talk about the staff attorney, because I just wanna see how they're gonna work together.
all right, trustee
May
Vela.
President.
I follow up part of that discussion?
Sure.
I mean, general counsel may feel like staff attorney is helpful or in the way. And they may not be able to fully answer these questions, knowing that there may be another person in the puzzle. And we're not gonna determine that puzzle until after the deadline for this puzzle to be put in place. So, I mean, am I making sense?
I totally agree with you. I think we have so many moving parts here that you
Yeah.
almost have to make this decision and allow yourself time to make that next decision.
But it's hard to make this decision if you might bring in someone else to do part of this work.
Well, you'll have the 30-day option
they're
out.
not,
yeah.
they're not compatible at all, and that could happen.
And it may affect the price of this
Yeah,
decision too.
absolutely.
So with all fairness, Mr. President, if the board does not have an objection, I'd like to make a motion to,
I don't think we can.
Just say what you want, Mark.
I'd like to make a motion to discuss item 4,
The
Item
staff attorney,
staff attorney.
All right,
it's 4,
okay.
Could you say?
All right,
suggestion A4.
all right. I have no objection. Does anybody have any objection? Because we cannot vote on your motion.
Right,
So
but
sorry.
we can always come back to this.
Right, but there's no objection to go ahead and moving to number 4 at this time. No objection? Okay, then we'll go number 4. And if administration will now move to number 4, number 3 has not been concluded, so we still will come back to that. But a suggestion's been made, and the board is so inclined to move to number 4. Discussion regarding in-house legal counsel services. Dr. Gonzalez.
Yes, sir, Mr. President. Administration utilizes multiple legal firms to provide a wide variety of legal services to meet district operational requirements, and administration is exploring adding in-house legal counsel to our staff, and Mr. Miller has more information for us. This item is for information purposes only. But if you want me to jump right into your question, sir, I can do that.
Yeah, go
Okay.
for it.
So one of the things is, we had the opportunity to visit Brownsville ISD. Brownsville ISD is the only school district south of Corpus Christi that has the general counsel and in-house. And one of the things that we found as a school district is we have our general counsel, but we also use a lot of other firms. So if we have a question about special ed, we'll talk to our general counsel, but then we'll also talk to Beekler, and Beekler will handle special ed. And then we'll have questions about Title IX, and we'll talk to Walsh and Gallegos. And then we'll have other questions that we may talk to the O'Hanlon group. So we're already working with multiple law firms already in the current world that we live in. What we found with Brownsville is that they have a general counsel, then they have in-house counsel who's a lot like an assistant superintendent. One salary, they don't bill on hours. And on the day-to-day, we would be able to walk across the hallway and ask a question immediately about the Texas Education Code on Chapter 37 for discipline. Or if we have a Title IX question, or if we're working on contracts, we'd have somebody on staff in the ELT that could answer general legal questions, but they would still work in conjunction with the general counsel, right? So it's not one that's going to overpower the other. I think that when you get into bigger cases, like the one we just settled, then obviously the firm, the general counsel would be working on those bigger projects and not get bogged down on the day-to-day, because we may have a question for general counsel on a day like today, and it may take us 3 hours to get the response, when it could have been walk across the hall and get it in a minute. Right, so that's kind of the efficiency side of it, and in looking at the numbers, we could also present some cost savings in this environment. Where we have one firm that's a jack of all trades, and then we have general counsel. We'd still be using bond counsel, we'd still be using delinquent tax attorneys and things of that sort. It
So,
would streamline.
so, Dr. Gonzalez, if I may, contracts, day-to-day operation, who handles that?
Ale.
I work with Crane. I have-
Well, no, I understand that, but in this.
General counsel,
in
just say
this-
general counsel.
General counsel.
Right,
General counsel.
so with this model, who would handle the day-to-day stuff?
Our in-house staff attorney,
Your in-house staff attorney, okay. So he's gonna do contracts,
he or she.
he or she, right, or they are gonna do contracts. Legal questions about a booster club, who would do that?
In-house,
In-house. Okay. At the point where the in-house does not have the answer, then he turns to general counsel.
yes, sir.
Okay. This is why I think the board is asking the questions, because now the description is a lot less for the general counsel, because the general counsel is not having to deal with day-to-day operations, which I can see why now price would become an issue, to where we need an attorney or a general counsel that has to know and be very good at special education, Title IX, and not have to worry about spending a week or two signing a contract for a parking lot,
Yes.
right? So it becomes more efficient. Not that our current attorney is that our current attorney is dealing with so much that it's not efficient to have someone do everything. Is that what we're getting at?
Absolutely.
Okay, but at the same time, there is a department, or there's departments that we can consolidate to where our legal department, because now we have a legal superintendent, besides day-to-day operation, what other maybe areas can that person be in charge of?
Yeah, one of the things that we've seen is the proactive side of training. So in Brownsville, you're getting trained by their attorney with regard to X, Y, and Z. Everything we train on would be coming from an attorney, so legal questions would be answered on the spot. And there's a whole different level of credibility when you're being taught Title IX by an attorney, or you're being taught Chapter 37 by an attorney, or you're being taught X, Y, Z by an attorney. So I think that Brownsville has an advantage when you have Mr. Salinas going across the district training.
Do we currently send our employees out for training?
We do, and it's in-house. It may be John Wilde talking about Title IX, John Cavazos talking about contracts, things of that. So it's people that don't have legal backgrounds that are trained.
Can a staff attorney stop other board members from interrupting board members?
No, sir.
Can I talk again now, sir?
No, sir.
Never.
As long as he makes you pay the $100 for your health insurance, I'm good.
I'm just making sure you're aware, Mr. Shaw. I just have a few more questions. Good question, sir. Good
Yes,
question,
yes,
sir.
sir.
Good question.
You still have the floor, trustee.
No, I
Swanton.
haven't. I yielded to him. I yielded to him.
But he has not concluded, so. I'm sorry.
Ito, you can borrow the floor until I'm ready for another question.
Mr. Swan is going to have my time back.
There you
Thank
go.
you, sir.
You have the floor. Trustee Alvarado.
I'd like to interrupt
And
real quick.
they're all-
I'm kidding.
And they're all good questions. Actually, yeah. Well, Mr. Vela disagrees, but, So going back to the Brownsville model, I'm just curious, who did they hire? Was it somebody local on their staff attorney?
A gentleman by the name of Miguel Salinas, long career in law. His wife's also an attorney, so
Experience on school side?
tremendous amounts of experience, yeah, so.
What was the range of salary? I don't want to discuss his salary, or do you have a range?
He gets
What-
paid like an assistant superintendent.
Okay. And then, did they see a decrease in their general counsel contract?
Yes, they saw efficiencies in, because they were in the same situation we were dealing with multiple law firms, and then bogging down general counsel with day-to-day operation.
So they saw, they do have a cost savings that he showed you?
Yeah, Ms. Gonzalez talks to Mr. Crane daily, multiple times a day.
So that's billed every time you call? Well, not really, because we're paying a flat fee.
Yeah.
We're paying a flat fee.
Mr. Alvaro, can I add something?
Absolutely, sir.
Part
You
of
know
what
you're
you-
giving it up to him. Right?
No, no, but
I'm
just,
actually done. Yeah, I'm
no,
actually
no,
done.
but to your point is, I think what you do is you make it lucrative for these attorneys that have had a lot of experience, that have their own practice, that are paying high dollars in health insurance for their families, for themselves, to say, look, I might take a bit of a pay cut on the top, but man, but the benefits that I'm getting working for a school district, my salary is not so much a base salary. You have to add everything into the salary, your insurance, your 401k,
Yeah, it's good
all that. So that builds up their salary, and I think that's what, I don't think we're gonna get a person straight out of law school applying. I think you're gonna have these attorneys that have been city attorneys, that have been school district attorneys, that might have a lot of experience to say, hey, you know what, I think I'd rather do this than to get 75 phone calls a day from different clients and going to the courthouse and dealing in-house. Just my opinion, but.
I'm dead, sir.
All right. Any other questions? Trustee Vella?
Well, yes, and I think going out for a person to fill this particular role who would be an employee of the school district, not a freelance.
Yes, sir.
You have a lot of qualifications to fill, school law, et cetera. I mean, it might be difficult to find a person unless they're fresh out of law school, and then what are you getting for that? And we know over the years, different outside councils have had different opinions on the same matter and given different advice on how to fix a problem that we might be in. What are we gonna do when the staff guy tells us to do this and the outside guy tells us to do that? And I don't mean use guy in a bad word, but what if one attorney tells us to do this? Who's liable for that?
Well, you know, my thought on that, and that's been a real weight, and it just so happened that my experience, I had an in-house counsel assign me, and I had 3 outside. And you have to have very specific guidelines. And one of the concerns I've seen over the last year or so is a lot of shopping for answers. And I say that because I get the call, and we as a board have made a decision, and now I'm getting a call saying, well, we met with X and X and X, and I'm not mentioning names, but we all know what I'm talking about, and they think it ought to be this because they talked to so-and-so attorney, who happens to be one of our general counsel, and it's a different opinion. My response up to now has said, well, then it has to go back on the agenda because the board has made a decision based on that legal advice to do this. So if you want, you, Dr. Gonzalez, or whoever I was talking to, you now have a different opinion, and it's significant enough that it requires board action, and let's put it back on the agenda. It hasn't happened, so it worked. But it is a concern of mine, is shopping for answers. It was that for my employees, it was that way for those of us in leadership in the company, and we were specifically told, you don't shop for answer. The answer you get is based on the issue at hand, and for us it was very delineated, and we're going to have to delineate it here. If first party versus third party, you know, that sort of thing. In this case, I feel, Trustee Vela and others, is that if it's that the in-house, general counsel should be assigned to the board. And that general counsel would sit up here with us if there was a grievance, so that if we do the in-house counsel, they would be sitting there. So, and then if there was an issue of the things that pertain to us, and they're listed in our board policy as to what we're required to do, it would be general counsel. For example, we hold deeds and trusts for the school district. We don't do that in isolation. We get a recommendation from the superintendent, he brings it to the board, we decide, well, they would go to our general counsel to prepare those documents. If the administration again says we want to go into an interlocal agreement with the city of McAllen or the county of Hidalgo or whomever or another school district, it would go to general counsel because they would be advising the board of those legal matters that we need to be prepared and prepare those documents for us to vote on. I think it makes it a lot more streamlined if it's matters pertaining to the board that the general counsel be ours. And if we do go the in-house counsel, route, and those are truly the day-to-day, because the reality is you're going to be doing what you're saying. And let's say we have a situation where the board, in my opinion, makes a decision on a grievance, for example, or like, and now the superintendent's been given instruction, and the other attorney has some points that were raised as a matter of law. I think they have to both agree. They have to both agree. And they can work through the day-to-day with the superintendent, and if it requires us to come back, then we come back. But I think if we can do that to keep them, I know in a prior conversation, Dr. Gonzalez said, well, the board can also use the in-house counsel. Then we start shopping around, and I think that's when we get into some real problems. And in my experience, when we were assigned specific, for us it was easy, it was coverages. If it was X coverage with this firm, if it was first party, went this firm, and you didn't shop, and if you didn't agree, you went to your leadership. In our case, it would be back to the board. We're the leadership to discuss. That would be a suggestion.
After you.
Could we watch the presentation, and it might answer some of our questions?
Well,
Let,
Dan,
I
you
want
start off,
to
okay?
hear Daniel.
And to follow up on that question, what does that do for us assuming liability if now we have an employee telling us how to act on a legal matter? Is it gonna change our liability coverage at the end, that the district has? Are we now liable instead of an outside firm that has full coverage for malpractice and or for, is that gonna be on our shoulders now as opposed to,
Yeah.
you know, so.
Plus, you have no cause of action against them, where
We
now you
don't.
do.
He's an
Now you do,
employee,
yeah.
and then if you get rid of him, well, then you have a cause against you. So I'm just asking if we aren't entering into another layer of inefficiencies as opposed to making it more efficient. And are you gonna get your best bang for the buck with one person who has knowledge in all of the areas that we deal with? You know, talk about grievances. We have a firm in here that is very, very good about handling our grievances. And you're gonna give up a lot of that experience and that intellectual capacity by bringing in a person who may not be ever sat in on a grievance. So, I know you're dying to ask them, so
Yeah,
I'll yield the
and
floor.
I want to move on to the presentation, but, and I said it before, are we putting too much on this person? Who handles our questions about special ed right now?
We have a lot.
Outside firm.
Outside.
Beaker.
Outside firm.
Beaker.
Who handles our Title IX ones?
Walsh Gallegos, Steve.
And then
Kevin.
our general stuff is general stuff. So, let's say, because I'm back on the issue of time here, this is a loaded person right here. That- Huh?
They wouldn't deal with those issues, general counsel.
Well, but you're asking this person to have knowledge in all of those areas. Experience, not just knowledge, experience in these areas.
5 years.
5 years, you know, and then your special ed. My experience with special ed is people who deal with special ed are very particular and have really studied special ed. So what happens if our RFP, RFQ, whatever it ends up being, we don't have someone that has all of these or meets these? Where do we go from there? You know, this is a person with very specific and issues that, you know, the district gets sued for all the time, you know? So what happens if we don't find that person and we're June 25th and we got 5 days to fill this spot, you know?
As far as filling the spot for our general counsel, I think that's step one, right? So finding a firm that would represent the board and the district, and then the next step would be to look at in-house counsel. So step one is to get general counsel set and in place, and we already have our game plan, right? Even if we didn't have an in-house counsel, we're already going to operate the way we've been operating with the people that we do. Now, we believe that person does exist. We believe that there's somebody out there that does have that experience that we can benefit from.
I
And
believe it too. I just don't know if they're willing to do it for, you know, the cost at then. You know, there's so many just things that come up here with, when you throw this kind of experience out there to catch somebody. I think we'll find someone, I
hope so.
really do. But it's just, it troubles me that we're at this point and we've got such a big decision to make.
Just a
Yes, sir.
comment, and it's more of a rhetorical question than anything else, but outside counsel may be reluctant to even bid or come into qualifications if they know that there is a person in-house that serves a similar function to this district. And I wonder if that would preclude anyone from being as aggressive in wanting our business or not. I just,
On the flip side, though, that may encourage somebody to come in because they know, you know what, I won't have to deal with the contractual items that, you know, someone would consider tedious.
the only thing I'm gonna say about that is that in the history that I can remember of this school district, we've never had an issue with contractual problems. And I don't ever wanna have an issue with contractual problems. And so I think we gotta bank on history, you know? Heck, history is not an indicator of future, how does a mutual fund say, for future performance, but I'm banking on history here. Thank you.
Thank you, trustee.
Just point
Oh, hold on a
clarification,
second.
I'm sorry,
I'm sorry.
on what he
Just
said.
so you know.
Dr. Gonzalez, so if
Debbie,
we
you're
go
next.
first with the general counsel and we have a contract with them, did Brownsville do the same way, or, okay, did they go back and modify that contract once they brought in the staff attorney?
Well, they've had a staff attorney for how long in Brownsville?
It's not like 7 or 8 years, yeah.
Yep.
Okay, but when they started the process, did they hire that person and then go modify their general counsel contract? Because I don't see the savings here.
I don't know in what order they went, but the savings that we see comes in the fact that we'd be able to streamline the amount of firms that we're dealing with. The assumption being that we have general counsel that has the
same
expertise
contract.
that we need.
Okay, so that's where I was confused. I thought we were gonna lower our contract with
No.
them because their staff attorney would take on more.
No. I think we'd be in the same neighborhood as far as what we're paying our current firm. It's just we wouldn't be using all the other firms that we're using right now, because we'd be getting most of our work taken care of with general counsel and in-house. And then bond counsel would come in where they need to. I think we wouldn't replace them. Delinquents tax attorneys, I mean, they do their things, so we'd still work with that firm.
Trustee Varela.
I just, I mean, I do want to watch the presentation, but I just don't see how we're going to have cost savings. Like, to answer what Trustee Peña was saying, we have a contract with a special education law firm until 2023. So does that mean we're going to call up that contract and do the 30-day cancellation? I mean, if you get to the second slide of the presentation, it's going to show you all the law firms we have. They are very specialized law firms that we use in small amounts. It's not outrageous amounts, it's very small amounts, but it's because they're very specialized and very deep. And so, to whatever, you know, I don't think that we're gonna find one person that is deep in all these areas, whereas if you have general counsel, you have a law firm, let's say 100 people deep, you have expertise in every single field, and they can go to them for the different things. So I don't see the cost savings. I still see that we're gonna have to use general counsel. I still see we're gonna have to use these specialized law firms for these special, you know, different areas of law that people are board certified in. I mean, one person's not gonna be board certified in all these different areas. I just don't see the cost savings, and that's why I really wanna see the presentation. And then I do have questions, but I think I'd like to wait until we see the presentation.
Any other questions, Trustee?
And-
I mean,
and-
Dr. Gonzalez.
Yes,
you had a
we,
question?
and we had the very same concerns, but in looking at Brownsville, they're right under 40,000 students, so they're almost double the size. And they've been able to be very efficient with the law firm they're dealing with, their general counsel, working in conjunction with their in-house. So we have seen some evidence of it being able to work. Now, that's a certain chemistry with the firm and the in-house that they have, and we're hoping to find that same chemistry.
I think my thing is, if our goal is cost savings, if that's our goal, there's other area, I mean, is that our goal, cost savings? Is that,
It's dual. I think it's efficiencies also,
Yeah.
day-to-day efficiencies
I
in
get the
conjunction
day-to-day
with cost
efficiencies,
savings.
for the, like, the minor things, that, you know, but if I mean, there's, you know, if we want to save money, we can look at our engineering firms that we outsource. I mean, you're spending millions of dollars, or, you know, all the different engineering things that go out. We can take an engineering firm and do that in-house. I don't see a cost savings of bringing a law firm in-house, because the general counsel that we do now, they have a contract for $240,000. If we're gonna increase and add another assistant superintendent, and then give them the benefits and give them all that, you're already almost, I mean, not quite at that amount, but yeah, so now you just went from general counsel of 240 to now you've doubled it. I just don't see the cost savings, but I'll yield the floor, and let's see if y'all can convince us otherwise.
Yes,
Uh, Are we good now to move forward? Okay, I think we have a consensus, we're moving forward in the presentation, why don't we go and do that? But just one quick thought, there's nothing to say that at this point we move on this, we could move this to a later time, it's Doesn't mean, you're not moving for something, a decision tonight. You're just bringing this to the board so we can have a consent, conversation.
What we're doing,
Exactly.
This is very helpful to us.
Good.
Well,
Go ahead.
could we vote on it? We couldn't anyway.
No, but,
Where's our counsel to tell us?
No, I mean, that's
No,
why I was a
no.
little confused. I thought-
Everything we voted on, you're off the insurance, bro. Let's go.
again, we're working off consensus. Consensus means we don't take a vote, we just see the opposing polls. That's not polling, that's taking a vote, that's allowed under Open Meetings Act. So let's go ahead and go to the presentation.
Certainly. So tonight, discussion regarding in-house legal services. There's only 3 slides. So the district has spent at least $1,552,613 for legal services over the past 5 years. And there's a small sampling, Alice Hall and Rodriguez, general legal counsel, to include purchasing HR, court orders, grievances, discipline issues, open records, FERPA, et cetera. Icobama Wardell, staff training to include Title IX, OCR complaints, et cetera. Walsh and Gallego, staff training to include Title IX investigations, SPED, and 504. Speaking of Walsh and Gallegos, I do want to point out that sometimes we do bring these legal firms to town and train our folks and also principals and things like that. So it's not always us sending one of our employees to go out to get the trainer, it's bringing that law firm to town. O'Hanlon, General Legal Counsel, and Beckler, SPED. Brownsville ISD, as Dr. Gonzalez pointed out, is the only Region 1 district with in-house legal counsel. TASB reports 32 school districts around the state has in-house legal counsel. City of McAllen has their own legal department, staff of 9, including 5 attorneys. The County of Hidalgo does their internal civil litigations, of course, handled by the district attorney's office, and they contract out with Jones Galligan out of Westaco. And the estimated cost for in-house legal counsel services estimated at $175 for 1 staff attorney and 1 paralegal secretary. One-time setup for supplies would cost about $7,000. If we move forward, as a minimum, administration would consider advertising the staff attorney vacancy on our career page, of course, TASBO, TASB, career page, risk management, career page, Indeed.com, for example. While the cost of seeking legal counsel is a concern of every school district, the cost of not seeking timely advice may be even higher. So early consultation with legal counsel can save the district money in the long run by preventing the matter from developing into litigation, or at least minimize the risk of expensive litigation and liability. Without adequate information and advice, a school board member, a district administrator, or other district employee can expose the district to legal claims, threats of litigation, or even legal liability. In-house legal counsel is generally more familiar with district personnel and operations. They are uniquely positioned to identify and reduce legal risk in the district, advise district officials within the context of local needs or other considerations, to anticipate interconnected legal needs that reduce future legal risk, and to enable the administrators to seek answers earlier from in-house counsel instead of guessing and hoping for the best when trouble is brewing. And last on this slide is, when in doubt, particularly employment, open records, and SPED, the district should seek counsel sooner rather than later. On the last slide, examples of some legal situations. Administration is considering adding in-house legal counsel services to A, act as legal consultant and advisor to superintendent, district staff, and board members, monitor compliance with competitive procurement and purchasing contracts and applicable documents, for example, MOUs, provide legal guidance and assistance regarding HR-related complaints, disciplinary issues, suspensions, terminations, contract renewals, non-renewals, grievances, investigations, district rezoning issues, court orders, which includes divorce decrees, temporary restraining orders, subpoenas, etc. HIPAA, FERPA, ADA, Title II, Title IX, OCR complaints. And also, equally important is to help coordinate responses to investigations by and represent the district, including Board of Trustees and administrators, when dealing with the U.S. Department of Equal Employment Opportunity Commission, EEOC, U.S. Department of Education, Office of Civil Rights, Texas Education Agency, Texas Commission on Human Rights, and other state and federal agencies, and to assist with special education-related issues, and then provide staff training on Title II, Title IX, sexual harassment, etc. Well, that's the last slide. We went down, I think, 2 weeks ago, roughly, to Brownsville, and I really enjoyed it, and the lawyer mentioned that he was going to participate in the new teacher orientation the very next day, so I went down on Saturday and just observed their new teacher orientation, kind of benchmarked them. And I really liked, he talked about a lot of stuff that HR would normally provide, but I think hearing it from the lawyer adds a lot more credibility, and the questions from the audience was just dead on legal. So, and that's the last slide I have.
So we don't need HR then, right?
No,
I would say.
I wouldn't trade them for a whole law school. I wouldn't trade these guys.
Exactly, I wouldn't trade them either, so why? Go ahead.
I just,
Trustee Alvarado, you have the floor.
Go back to the first slide, sir.
Yes, sir.
1.5 million over 5 years, so my math, that's 300,000, right?
310,522, sir.
And we pay 240 for our general counsel.
One of them.
One
Up
of
to,
them.
right now, we're only at 128,000. And the other ones were at,
No, our current,
our
Mr.
current general
Plains. Wait,
counsel
wait.
is at, right now, if you get
A
on our
year.
website,
It's
right now, what we
240.
paid them, it's only, up to, it maxes out at that.
okay.
But we've only paid them 128 this
Okay,
year.
but what did we pay him last year?
Annually.
It's usually an average of about 230, 240.
230. I'll just take 230.
Some years over. Right, it's coming out recently to about 25,000 a month.
Okay, so 230 minus 300,000, again, Aggie here, so my math's not always good, that's 80,000. We're not gonna hire another staff attorney for 80,000.
I
So
don't,
where's the cost savings? So maybe we shouldn't be saying cost savings, maybe it should be
One where I give you
just
the
efficiency. Because I thought there was gonna be a significant cost savings, but
Right, that's what
I don't see it.
There isn't.
that's what I thought too.
You still have the floor.
I'm dead.
You had, and then trustee Vella.
That's fine. Look, I like the fact that our board president and, I mean, not our board president, but our superintendent administration is looking outside the box. I think it's a great issue. I think it's a great thing. I think the timing's off because we're going out for general counsel. Had we already have a general counsel, they could be in this room discussing with us what we can do. And just so you see the cost savings in the long run, when you get all the attorneys that we have, and you give those duties to general counsel, and then you take away the day-to-day operation and put it with the day-to-day attorney, there perhaps could be a cost savings. If not, it can be mute, but there is some efficiencies. But I think that right now, I think you put the board in a predicament to try to make that decision when right now I think the most important thing is finding the general counsel that represents our district, whether it be the current attorneys that we have now or a new attorney. And then after that, I think, after we transition, then maybe perhaps revisit this. But I think that all of us are in the consensus that it's not black and white right now to us. And so,
Can I piggyback off you, Mr. Slice?
sure.
Just, I guess what I'd like to see from Brownsville, I point to you, there's 8 years worth of data there. Have they paid less to the general counsel through that time? Because that, to his point, if they hired a staff attorney and they took on more responsibilities, well, then hence, they shouldn't be paying more to general counsel. You should see a decrease. And so I think we're missing that portion of it. I would assume, to what you're saying, that staff attorney gets more familiar with SPED, for example, special education law. Maybe the first year they're spending a little bit more, but as time went on, they don't spend as much because he's become more familiar. So I think, since you referenced Brownsville, I think if we spend a little bit more time seeing we can get that information, that would help me.
Because all of us here are going to agree that at first it's going to cost more money. I mean, you have, plus, and that's okay if in the long run there's money, but there's certain departments, not HR, but that you could give to the attorneys or to that superintendent that could fall under his guidelines, and perhaps save money that way. But that's not presented right now, and I think that with time, I mean, I go back to the same thing. I think the timing is just off right now.
Trustee Vella, you have the floor.
Thank you.
Then
Mr. Miller, in our committee meeting, we discussed how many school districts out of the almost 1,100 in the state of Texas had in-house attorneys, and I think you just mentioned 32.
32 according to TESB.
Do you know what those 32 have as a common denominator that would require them or would make them think they need an in-house attorney?
They seem to, size-wise, population-wise, they seem to be all over the board. A lot of bigger districts, of course, but they also had some smaller districts that was surprising.
So you
only
could
one,
say that-
only one was our size, which is McAllen ISD, Houston. All the others were 30-plus,
So much larger than us?
yes.
So, no, I think there was some small ones in the list. that you
Yeah, there were
went
some
over.
in the-
There were some really smaller ones, much smaller ones. Okay.
You have the list by chance?
No.
So we can pretty much rule out size being a determining factor for an in-house attorney? Because there's some humongous school districts out there that don't have in-house attorneys. Could it be previous legal issues that a district may have had that brought in the in-house attorney?
Could be. Hard for me to speculate, honestly.
Good research question, Mr. Mayor.
100%.
I mean, are 32 school districts right and the other 1,000 wrong?
Could be.
Another rhetorical question. I mean, shame on us. I'm done. Thank you, Mr.
Yes, sir, trustee Vella, and I apologize for interrupting.
No, it's all
I was
right.
just trying to bring clarity in my own
Workshop,
mind.
we're-
Yes,
we're good.
all right, sir, thank you. Trustee Peña.
So, we don't have a staff attorney right now, and we're gonna take all of these huge matters and expect this one person, I know we're gonna, it is, upfront, we're gonna spend money, and the cost savings will be seen later as we go on. I get that, but I'm gonna yield the floor. I don't think that we're at that point right now, and I think that this is, again, I go back to the weight of these issues, and you're gonna bring in one person and pay them, you know, if it's 240,000, the cap or whatever, to handle all of these issues, and then we're gonna resort to having to find other people to provide that support to this one person. I just don't know that this is the time for it. It's a lot, I'm just saying, it's a lot to put on one person, these, you know, and I know it's his preferred, so maybe they don't have all that experience in SPED, and they're gonna get better at it as they go, but are we in a position to wait and let them get better at it, and we're expecting them to teach our staff too, and to do all these other things? I just think it's a lot, and we're not going to see any cost savings. The public will not see any cost savings immediately, because it's gonna be a lot. I know you're bitching to answer my, and it's rhetorical, I don't need an answer, I just wanna make a statement about that. I just think it's, these topics, these issues, these matters, SPED, Title IX, and everything else, it's a huge one.
I understand. I really, I like, personally, I like the idea of being able to be more proactive, being able to go across the hall or down the street and get an answer right away, because sometimes you need these answers
I
right
totally
away.
get that too, yeah.
And the issues, especially on the HR, you get into the EEOCs and Title IXs and things like that, they're very touchy. So I think, this is my opinion only, I think that that person is out there, and I think we could find somebody that could take a lot of pressure off of the general counsel and then allow us to be more proactive, and be able to provide better support and liability protection, just like the slide says there, on some of these key issues, investigations and such.
Maybe that person is a compliancy officer, an attorney, someone with a law degree, but it's a compliancy officer to make sure that we're being compliant with the Title IX, with being stuff, and they confer with our general counsel, but maybe the position is a compliancy officer. Just a thought.
It is a thought. Trustee.
Piggybacking off of Debbie's comment, why wouldn't we, when we negotiate general counsel, say, we have an office that we'd like to have one of your younger attorneys that has a direct contact with them, and say, why don't we have that person housed here at the school district, and the tedious things for the contracts or something like that, we can give to them right then and there, and then the larger questions, have general counsel be that person that represents us.
Change the scope of the general counsel's duties.
It's still within the scope of general counsel duties, but they're essentially giving us a paralegal or somebody that would be right there that can easily deal with some of the legal questions that we have.
I liked it till you said paralegal, but if you switch it to attorney?
I mean, I think there's plenty of young attorneys that are out there that are hungry, that are signing on with some of the larger firms, and the firms kind of just, they give them some of the smaller tasks and take care of this little case, take care of that little case. Well, if we've got a firm that comes in, and let's say our existing firm says, you know what, we've got a kid that just graduated from UT, and he's coming in, and he's hungry, and he wants to develop into a school law attorney, would you house him at McAllen ISD? He's still on the general counsel payroll, he knows he or she knows the basics of contracts and litigation, but they're still working for general counsel.
Bad idea?
I'm not, I see your point. You want to be able to get your answers fast. These are matters that require immediate response and not something that's going to take 3 days, a week or longer to get a response from. I get that. I just think that, it's a lot for one person, because we're not necessarily getting a firm. We're getting one person on staff, if we're getting a firm, different story, exactly. They got people they can go to, and maybe this person will have outside people he can consult with and whatever to help get his answers or whatever, but we're getting one person, and if you're gonna have him giving you Title IX answers all this week and then sped stuff's coming in too. I just think we're asking a lot of one person with some topics that some attorneys take years to specialize in, you know? That's my concern. Are we putting too much on one person? And I don't want that to happen, and then this turns into, oh, now we gotta hire this attorney, and that attorney, because we've overwhelmed this one person. That's what I'm trying to avoid.
I just want to make sure, if two questions were brought up that get answered. I want trustees Vela point to the liability. If we were going to go to a staff attorney, would it increase our liability? I don't need to know the answer right now, but that's important to me.
Yes, sir.
And then the second one, if we can deep dive
Take a deep dive.
deep dive into Brownsville's model or someone else's model to kind of see, because I know what Trustee Peña says is probably, one person, but it takes time, and that one person if they're not comfortable with the case, they're going to refer to general counsel, all that stuff. We can give a little bit more if there truly was a savings, because I know we pitched a savings, maybe it's not. If it's neutral, that's fine with me too. What I don't want, from my standpoint, that they saw an increase of their attorney fees over an extended period of time. That's the only thing I'm looking at. And so maybe Trustee Sandoval, we can revisit this again, but to Trustee Suarez's point, I think we need to get back to general counsel, just decide that, put it out, and we have time to bring back the staff attorney.
Yeah. Any other thoughts or comments?
Just so that we don't beat a dead horse, I'd like to suggest we go back to
Well,
talk about.
I do have some comments.
Oh, I'm sorry.
Yes,
That's-
Sam,
that's-
yeah,
If I
yeah.
may, thank you. To me, as I mentioned, my experience, there were third rails. And by the way, our company did move away from in-house counsel because there wasn't a cost savings. And plus, logistically, everything changed, and we started consolidating, so that changed things. But be that as it may, these, to me, are the third rails. Students. To me, it cannot be used in such a way that would put students in a position other than is allowed. And it could benefit them in the broadest sense. So in that sense, that is a third rail for me. The other is parents. It cannot interfere in any way, shape, or form with parental rights and parental involvement in public education. That is a third rail for me. It cannot go there. And unfortunately, there are always going to be legal issues in which you get to that line, if not have to get past that line. I understand that. But that would be, for me, a real issue to have to sort out as to how you differentiate in-house and out-house general counsel and insiders. Because if there is a question about a parental right to be involved in a child's education, even if we differ on how that should be, in my opinion, it should not be a staff attorney paid by taxpayer dollar in a school district that they pay taxes to. General counsel is different, because there are liabilities that they absorb and they must, in advising us, and we can take it or leave it. So that's the second third rail. The other is board governance. And I saw a little bit today, and it's a little disconcerting, is somebody should have looked at what the statutes say, and more importantly, what board policy, starting with the A's, because the A's talks about governance and establishing this body corporate. And it's very clear the authority that the board has. There are limitations, but aside from those named by law, then they fall to the board. And none of the statutes talk about the board's role in differentiating when it comes to procurement. In fact, you're allowed to be involved. We have to vote on those things, whether we do so through this process, since it doesn't involve construction, but under professional services, it's the board's purview for that. And the fourth one is intra-governance, is our role in relationship as a district with other entities, whether it be the city of McAllen, other school districts, the state of Texas, federal government. I think that has to stay within the board. And I think general counsel needs to be advising the board on those decisions. Not to say, there can be conversations with the superintendent with in-house if they so, but when it comes to board action and board decisions, we can't have that difference there. And somehow we need to, look at, I thought we were consolidating to one general counsel and one out. Now, a point's been raised regarding special ed, 504s, then maybe we need two with one specialty there. But again, going back to third rail number 1 students, which is my experience, there were a lot of times where my family was at odds with the district when it came to educating my child, and an attorney was brought in. And that's okay if it's outside, but if it's one that I'm paying taxes for, and why am I paying for my attorney here? Frank, and I'm paying for that attorney.
Paying both attorneys.
It doesn't set well for me. Since it's proprietary, I can't explain the equivalence of why I'm making that point, but those of you who understand insurance, you know why. So those are the elements that I see going, if we're going to look at this and going forward, I think there's some weight to it that should be considered. But the last point I'll make is, everybody said their piece multiple times, is I think we just agreed to the special ed attorney. It's a 5-year contract, right, with the attorney?
It expires in 1 year, 2023, it's a 1 year.
It's a 1 year left on hers? I thought we just approved hers.
We did.
It's a 3-year.
It's a 3-year?
Yes.
We just approved it January 10th, and it expires January 31st, 2023, with an option to renew for 3 years.
Oh, it's an option to renew,
Yeah,
but it's a
right.
3-year with an option to renew. Okay, but it's a 3-year, correct. And then we obviously we're about to do general counsel, and I think the board's already made that decision. It's a 3-year with an option, 2 1-year terms. And I don't know where the other attorneys are. Trustee Alisa could probably help me with that, with the other 2 general counsels we have. But the point I want to make is I think we should, as these come up, make that decision, and that will help us bridge where that might be. And we may be talking 2 or 3 years down the road to actually activate this. And maybe we do it in phases. Once we get this up and running, we consider what do we do with the general counsel in that area, and then release them and get to maybe 1 general counsel for the board, 1 in-house for the administration, and then maybe the special ed being separate. I will say this, I know I said one last thing, but it's been my experience that if you need something immediate, somebody wasn't paying attention. Because and I've said this to parents, and I've said that at board meetings, is there is nothing in this world that cannot have time, when it comes to public ed, time to look at it, consider, make a decision, and nothing says we can't come back if we see something that's different. So this thing that we got to have an immediate answer, and it has to be today, I don't buy it. I'm sorry, I don't. I think there's always time, again, unless somebody messed up, and I did have one employee it was due that day to file an answer on a lawsuit that they'd had that document for more than 40 days. And so if you had a document, and we got to deal with it, I get it, but that should be very, very rare. I think the norm, and I saw that in signing things, I'd get a text as soon as the meeting was over, and I read the stuff, So sometimes I didn't have time to read it that night, so I was planning to read it in the morning before I signed it, even though we had it in our packet. But a lot of times there's change. I want to make sure. And sure enough, there were times it was a different document. And so I want to read it, and I get another text. Or I get a phone call. When are you going to, well, I'm going to get to it. I'm going to sign it. And I think that holds true for our attorneys and anybody else we're doing business with. So that's my take on that. So unless anybody has any other thoughts, we can go back to item number 3, which is discussion and request for qualifications for 2023-1000 General Counsel Services. Dr. Gonzalez.
Yes, sir. We'll pick up right where we left off.
All right.
Okay, so if you look at the packet that's labeled specifications and scope of work, all the way, all those sections are standard, it's our standard language for procurement. The area where I would need you to look at, the term we've already discussed, which is on 5.0, we've already said it's 3 years. It's, actually, it should be a primary term of 1 year, 3 years, sorry, on that. It should be a 3-year with the option to renew for 2 additional 1-year terms. So your 5.0 will change. And then if you flip to section 15, everything else is just procurement, standard procurement. So if you switch to 15, in the event that we're going to stay consistent with the way we've been, we would remove the special ed and Title IX. So basically 13.12 would be eliminated.
We're looking at this document right here. Is
Yeah,
that correct?
yes, specifications. and
Do you have
scope of work.
extra copies? Does everybody have one? Do you have any extra copies, or we can get copies made?
Yes.
Yeah, I don't have that.
Crystal will get you one right now.
And what are we signing?
I know you sent it electronically.
That's the non-disclosure form regarding that you won't communicate with any vendors. We have all our end users sign one every
Oh,
time
okay.
we start a process. So
Because
you're
that's
not,
That's on the web, though, that's why I. or
they're not,
this is-
yeah. So
This
it's,
is on the web.
oh, that is,
But
yeah,
why-
yeah,
why-
that, yeah.
why are
No, the other
trustees
one's a
asked to sign it?
non-disclosure form, just saying basically you're not gonna be, remember at the beginning when I said we would all sign a non-disclosure regarding not communicating with vendors through this process until the award date?
Okay. Does that include our own general counsel?
It actually does.
Yeah, it's
I
not related
called,
to-
I called to ask a question, and I told him I couldn't get into details, and I just like, very hypothetical, yes, absolutely.
Anything, I mean,
Anything
outside the-
relate, yeah.
Outside of the scope of the question of the, if you have a
Business,
question of
right.
of legal.
Yeah,
Clarifying.
absolutely.
Okay.
But for us, just so you know, under board policy, it goes through either the board president or the superintendent if there's an inquiry of any substance dealing with the district. So it should be very rare of an interaction with us with current legal counsel.
No, I meant more on the lines of they're calling you and saying, hey, like, how many points are y'all doing for this? Just like simple questions about
that.
this
Oh,
process.
yeah.
Not about,
Yeah.
what time is the baseball game tonight?
Right,
We can
exactly,
talk- yeah.
exactly, yeah, related to this solicitation.
Right, yeah. What are the firms are behind, yeah.
Correct.
Yeah, but I was clarifying under the normal course of business between the board and our general counsel. That's the way it works, so.
And just to clarify on the expenses to date with our current general counsel, we're at 173,764 through the end of February. We still have March, April, May, and June for billing, and it's been averaging about 25,000. So we're probably gonna go, we're probably gonna hit about 275 by the end of the year. By the end of that's basically on average what we're doing right now.
How often does that website, the procurement, the checks, because I just looked at it, it was dated up to February 22nd. How often does that get updated with how many checks are written? Because I looked up like Neil Hanlon, I looked up everybody.
That would be an accounting question. It's an accounting question.
Usually once a month,
Okay.
on a monthly basis.
I love that. I love how anybody from anywhere can get on and see who we're paying, how much we paid them. I think that's fantastic.
Are you referring to vendor spend?
The vendor
The-
spend.
Ours,
Yeah.
okay, that's ours, yes.
Oh, I
So
love that.
we update that at the beginning of the month, every month.
Okay, yeah,
So-
and it's ranked highest. That's how I saw
Yes.
the engineers. I was like, what? It never even
So,
occurred to me.
yeah, we put it up there for transparency.
That's why we're an A+. That's wonderful.
So coming back, so basically on this,
copies.
on section 13.0, the scope of work.
I'm sorry,
Oh,
if you could hold on till
Oh,
we
yes,
all
sir.
get copies. I think we're waiting.
Oh, that's right, sorry.
Sorry.
And,
It's okay.
Can she clarify, you said this is gonna be, 275?
Well, at this point, we have spent, up until the day of the board meeting, which was last Monday, we had spent $173,764.
Right.
And that was billing
But you're
through,
projecting that we might get to 275.
because we have 4 months left and we've been averaging 25 a month.
Right, isn't our contract though 245?
We've been over on some months, they can charge us $175 an hour for different
If it
outside.
goes over that contract, that had come back to us for a
the other way.
modify it, or no?
No, it's written in the contract that they can start for, if it's outside the scope, they can go 170, yeah.
They can go over what?
It's 175 an hour. They start charging hours.
Now, while we're waiting, to a point raised earlier about cost, one I think we need to know, frankly, is what type of legal services have been incurred, because if you're a district that is generating a lawsuit, of course you're going to incur a lot more in costs, because you're now, when I first got on, I think we had 5 or 6 lawsuits happening. I'm going, wow. And we had several grievances. I think that summer we must have been meeting, if not every week, at least 4 or 5 times on grievances. Those add cost to it. So I think it's important to know what's in, are there any lawsuits under, and how many grievances are taking place? Because if that's the normal course, then you got apples to apples. But if you got a district that's dealing with those other issues, such as lawsuits and grievances, it's going to add to your cost. Something to think about.
Are we ready? So coming back to section 5.0, that's going to be changed to a primary term of 3 years with the option to renew for 2 additional 1-year terms. Of course, they all have that 30-day out clause, so we're able to termination without cause. And then if you flip, the rest of the stuff within this packet, outside of 13.0, is related to procurement. So if you flip over to 13.0, this is the area where we can eliminate the areas that you want to keep the separate councils. So I would, based on today's communication, I'd say remove 13.1.2, which is special education.
Do you have it to show on the screen? Because I can, we just need to be transparent, because then people are gonna, I mean, it wasn't attached to the agenda was it attached, so if
Yeah.
you get on board
Yeah.
book, it's there?
It should have,
Okay, that's all
we sent it to Natalie, yes.
Okay.
But if we could also-
If it's in board book, then that's fine, that's all.
No, I
Yeah.
believe that we kept it
Yes.
private, right? I
It
believe.
was, well, yeah, it's private right now, but I think it's important to show. There's nothing on that document, before we move forward, there's nothing on the document that's not part of public record, since it's now before the board, it's now public record, so you're going to have to show it. Yeah.
Okay, so on, if you notice on 5.0, that's the term, we're gonna revise that, that was an error on our part. It should be 3 years with the option to renew for 2 additional 1-year terms. And then the rest is procurement language, so what I asked the board to look at would be, and this is the evaluation criteria that I was talking about. This is from Texas Education Code 44.031, and this is the standard that you'll see on that evaluation matrix, where we pull stuff in and apply to that. Then the next section that I'd like you to take a look at is the beginning at 13.0. So it's a scope of work. And based on tonight's conversation, I believe that you want to remove 13.12, to remove all special ed in section 504.
Does anybody see it differently? Do we have a consensus on that? Anybody see it different? Hearing none, then yes.
So remove that, okay. Is there any other area you would like us to remove?
Or clarify, on section 8.0 references,
9.0.
oh, well, 9.0 as well, but on 8.0 references, I mean, I see value to if you work for municipalities, if you work for universities, if you work for, I just hate that it's so narrow that it says other school districts, so I'd hate to give weight to somebody if they're working for another school district, but what if we have somebody that works for a university in their law department and they want to apply, or someone that works for, you know, the city of Houston and they want to apply, municipalities, I'm sorry, I'm speechless. I just thought that was a little bit narrow there. And then on 9.8.2, does that mean the law firm, needs to employ 500 people?
No, this is just standard language from Texas Education Code. This is the evaluation criteria set forth by Texas Education Code. So these are the things that we consider when we're evaluating. And it's set, like, it's nothing that we made up, it's straight from the law.
So is there going to be weight to that is what I'm asking?
It's on the matrix, you'll see where we can, it's usually 1 point at most for that
Can we
section.
say we want 0 points for that?
We
That
can.
just seems to me like, you know, if you have a law firm of 20, I don't know, that just seems to me to exclude people from applying.
Usually, yeah,
I
usually,
just want to be very inclusive and let as many people apply as possible instead of being so tight that nobody applies.
we've never done more than 2% in that section, so it's 98% goes to everything else, and if we apply, we can go 0 if you'd like, but we've never done more than
They're
2.
only giving it 1 point now, right?
Huh?
According to this matrix, they're only giving
1 point, yes. Yeah, we've never, since I've been in this position, we've never done more than 2 points. So we don't want to penalize anybody for that.
I think if it's a matter of law, they intended it to be weighted. I think it ought to be weighted, and 1 point is a fair number. Because if you're so tight and so close, that might be the determinant, but that's a fair determinant, because everybody had that.
And
That's my
it's straight,
thought.
like I said, it's straight from the law.
But on that particular one, the last people who applied, even under vendor, seem to have 500 employees.
Correct, so he wouldn't have gotten the 1 point.
So did anybody get a point?
And there are some firms that I don't remember from the past, but yeah, there are in areas, maybe when we were doing construction, well, yeah, sometimes they do have larger firms.
Yeah.
So it just depends, but it's usually 1 to 2 points. We've never done more than 2.
So what my question was, has the last time did our current firm get that 1 point? No, they did not, because they don't have 500. So to me, I don't see too many 500 law firms. I'd rather go 0, just to be more inclusive, because there might be 1 or 2 or 3 law firms there, you know, because that 1 point is gonna be tight, you know.
Could be tight.
Could be tight. So anyway, I'm with you on this one, Ms. Crane.
Does anybody feel it should be 0?
Well, I just want to, just the process, just because they score high on this, Doesn't mean that's not,
Right.
that doesn't mean that that's the firm that's gonna get the position. You still have to be interviewed by the board.
And keep in mind, it's an or question, the one right above, it's an or, it's not just that.
But
It's
we
they have a
interview based on
principal
this.
place in Texas, or they're
We
500.
score based on this.
Right, and I think I
So
mean, it
I-
doesn't matter to me. Sam's point is that if the law requires them to have that, it's a stipulation, it should be weighted. Whether it's 1 point or 50 points, doesn't matter. But, you know, I mean, it's up to the board.
The reason I say that, it says or.
So if they have their principal place in Texas, they get the point.
Okay.
And so we
Okay,
probably
so
want
leave
a
it
local
as one.
firm. We
Yeah, it's
probably
or,
do,
yeah. So I was kind of taken aback when I heard they got 0, or they didn't get a point, because they have a
Yeah,
principal
They have a place
place.
in Texas, yes.
Yeah, okay, no, that's fine.
So you're not excluding, you're actually including, and there may be a differentiation there, I don't know. It's only 1 point, and if you either or, you'll be fine.
So-
Just real clear, right now, we're just going over this document,
Yes.
and then we're gonna have a
Right,
conversation on
correct.
this.
Yeah, we'll
so-
go over, yes, right.
Okay.
Coming back to Mrs.
Yes.
Aliceda's comment about the references. We used to just say references in general. We started seeing, and I'm not talking about legal counsel, I'm talking about in general. Sometimes it was irrelevant. So we started honing in on actual relevant experience with something that they're gonna be working with. And that's why we've been kind of switching it over to actually school districts, like in construction, we'll say K through 12 experience. So that's the reason behind it. I'm not sure if you still want me to change that, but that is the reason behind it.
I mean, I kind of like including higher ed and cities as well, but, I mean, you never know what you're gonna get.
Anybody have thoughts?
I can see higher ed, that's a valid point, but municipalities, I think the legal code between a municipality and a school district, I don't think it's comparable.
Yeah.
So I think,
Add
you know,
higher
if we
ed
say higher ed, then
Yeah.
I think
and
we're
or
okay.
school districts, okay.
Right.
We can do
Or
that,
just education.
okay.
Well, I tend to follow the, Texas Council of School Attorneys members. I think that, and they're listed by region, so, and they don't necessarily have to be within our region. I mean, it's up to the board, but I think that's a good net of individuals that are very focused on the laws that we've spent a lot of time talking about today that concerns us. That's my thought, yeah. That's just region 1.
13.2.1, represent district in cases before municipal, county, state, and federal courts.
Which one was that, I'm sorry?
13.2.1. 13.2.1. Represent district in cases before municipal, county, state, and federal courts. So we can't necessarily exclude municipal. I mean, they should maybe at least be able to reference the administrative codes and things of that nature, so.
So do you want to leave it open, just references in general?
I mean,
Like
it doesn't have to leave it there, just in case. We do deal with the city a lot and stuff, so it doesn't, just leave it.
So leave it general,
I mean,
just
right.
experience, relevant experience? Okay. Okay. So coming back to the scope, so 13.1.2, I'm eliminating, correct? That's the special education?
Let's go back real quick, 13.1.
So if we start at 13.0, and you can see that we divided it into sections.
I think it's the third page, they're not numbered, but it's the third.
Correct.
And it's second from the bottom. Does anybody have any other thoughts, concerns? Trustee Elisa?
I mean, you don't need to necessarily eliminate it, but you could add weight to it, so
Correct.
if you have, right, so,
So leave with less weight?
I
or-
guess, like,
You got a point there, you do.
and who, I'm confused on the weights. Like, every single thing here is worth 1 point, is that how
No.
it is?
No, ma'am.
No,
When
we'll
she
go back.
discusses
We'll go
this
ba- yeah.
other one, she'll show you the weight on that.
What,
So,
We're going to go over that
I
in a
wouldn't
Yes.
second.
eliminate it either. I
Yes.
wouldn't eliminate it because
yeah,
at some
So
point you
leave it?
may have a question.
you know, you
Okay.
might have a rock star out there, and woo, woo, give 'em, you know.
okay. And then, is there anything else that you'd like us to eliminate from the scope?
Well, does it have I'm sorry, does it have anything in here about being board certified in any specific area? Because, I mean, that's, to me, would be something great.
If you look at 13.3, those are the requirements, the successful respondent shall, 13.3 beginning there, and you'll see that they need to be active law practice for 5 years, they're licensed and good standing with the state Board of Taxes.
Yeah. I mean, to me, though, if you get somebody that's certified in certain areas, I mean, that's a real skill set that's very advantageous. I don't know
I think
exactly.
that might limit our respondents that have a general knowledge.
Yeah, no, I'm just saying for weighting purposes.
Well, and I don't believe we've ever used that. I don't think that, I'm not even sure our general counsel now would have that state.
In certain, well, you never know, like in bankruptcy law, they're board certified, or in civil
Yeah.
litigation, they're
I'm
board
not sure,
certified,
right,
or in,
right.
you know, special ed, they're board certified, or whatever. I don't know, I just think that would add, that is worthy of a weight. But
I think if they have it, they'll certainly add it into their qualifications. But I think requiring it or asking.
Oh, no,
for
no, I'm
it,
sorry, not requiring it, I'm just saying,
Preferred.
yeah, I'm sorry, I didn't mean
I
requiring.
wouldn't even put preferred. I think we should follow the statute here, but I think that can come up when we do our
Interviews?
interviews.
Thank you.
Because I think the interviews, that's where we may put, when you get down to 2 or 3 candidates, and this one's board certified, I'm
That'll
for
be
one.
that'll be one
If
of my
they're board
questions.
certified, they're definitely going to include
Yeah,
it. I would
okay, that's a
be-
good way to do it.
I would think they wouldn't exclude it themselves.
Because what you're now trying to do is get as many individuals in to apply, and then you can start narrowing to those you want to interview, and then from that differentiate, and as you mentioned time and again, and based on your experience, they're going to be very, very tight and close, and that may be the differentiator, whether they're board certified or not.
Right.
And we'll deal with it at that time as a board.
Okay, so if you look at this, did y'all get the second packet? It's a heavier one. This is what the vendor's gonna view online. It's probably in your documents.
Yes.
Okay, so the beginning is completely, just requirements. It's not until you start, that we are asking them for a statement of qualifications, and then their year's experience in different areas, and then they could check that off. Show it to you.
And the thing about this too is that there's nothing to, these are the minimum. If they
Correct.
clearly have other documents and other references and all, they should be attaching those, and most will.
So this is how the vendor will view the packet online, and all of these, I'm skipping through them because they're just requirements that they're attesting to different things. It's not until we get to the line items.
Ms. Gonzalez, that's the bid packet, right?
Correct. Correct. And like we've transitioned to online only, so this is how they see it. So this would be their qualification statement, and then their experience, how long the firm has actually been in existence. And then we're asking them the areas of expertise to check off, and maybe something that we left off. And then any other additional comments that they feel would benefit for us to know. And then we start asking them, like, who is going to be assigned to the district? And then start listing their names, and then how long they've been with the firm, how long they've been in the industry. We tend to give them, if they've been with a firm at least 3 years, we tend to give them the full points. And with the industry, we usually give them, if they've been in the industry 10 years, we give them full points, because we feel like that's a good, solid foundation. And then it just continues the same way, areas of expertise, their license number, the state, and then their clients, and so on and so forth. Then it goes to attorney number 2, and that just kind of, it'll extract it into an Excel, and then we could provide it to the board so that you can see them side by side. Okay, this firm has this, so it's a really neat way of doing it. Then now, based on that, we can look at the evaluation matrix on this is where we pull it. So if we do the RFP route, which we're gonna ask for pricing, then the price would have to have a weight there. We would need to know what you feel is the weight. And then anything in blue is from that section that Mrs. Alizada was referring to, which was section 9.0. It's all the law, the statutes from Texas. So it's all the 9 sections. And then underneath, we pull from things that we ask them and try to plug it into the different areas of the 9 criteria. And that's how we create the matrix. Now, the point system could be spread. Anything in red is completely negotiable. Like, we can add different things. We can add a certain kind of law in there. This is just general and is completely in draft version, as well as the points. So if there's anything in an area that you'd want to change points, and like I said, this is complete draft. This was just a preliminary to show the board to see what.
So, Item number 2, it says reference, and then parentheses says attitude. Number 4, attribute, yeah, sorry, thank you, attribute. And then excellence equals 2 points per reference.
Right, and so we have a reference form that they send out. We've been kind of delving into changing it up a little bit because most people, when you're giving a reference, you're only gonna give good references. You're not gonna give somebody who thinks badly of you. So we're trying to transition to maybe making phone calls and actually saying, well, how did it go? Were they on time? Did they provide quick legal service? That kind of thing, rather than asking them to send us a reference form, because they're only gonna send in the excellence. And so it's kind of like you're throwing away points because everybody's gonna get equal points. So that's the direction we were kind of heading. We're starting that with construction, currently, with our new project. So, before, that's how we did it. We basically said, if we request 3 reference forms, if they're completed and they're all excellent, you're gonna get all the points. But that's usually what we get. So there's not a lot of differentiate. And the moment you start getting that tight, you need to differentiate somehow. And so, that's one of the areas that we can tweak.
Question, Ms. Gonzalez, and I know it was discussed a few minutes ago about school district clients, and there was some discussion of maybe changing it to a more broad evaluation, or at least on the bid packet. And it's section 3, it says school districts clients. Is that what we were talking about a few minutes ago?
You're looking at, which
I'm looking at the bid package, the PDF file.
Yes, and so at that point, we're asking what kind of, list the clients that you've dealt with,
Would it be-
provide.
pardon me for interrupting, but would it be appropriate to say institutional clients?
Yes, we can.
Thank you. Anybody question, object?
No, I think that's on point.
And this will probably be broken up a little bit more where it's a line per, like, so the name is on one line and then another question, because you find, areas where maybe they forget to answer one of these questions. I'd rather separate them so that it's a required field, and then we get all the information rather than having to send clarification questions.
And they may not have that many institutional clients
correct.
or school district clients for
Correct.
that matter.
Yeah,
Thank you.
correct. Correct. So anything in red on this evaluation matrix, that completely negotiable. The hard ones, and I'll be completely honest, to come up with are when you're dealing with number 3 and 4. Because when you're dealing with 3, you're saying, well, the quality, how do I determine quality? It's very subjective. And so, and then the extent of them meeting our needs. So our needs is easier, I think, because if they have the experience, well, they're gonna meet our needs. So we tend to use, how long have you been in practice as quality? It doesn't completely give you quality, but that's one of those, areas in the law that we can't change the law, but we try to make it work for us, with those types of questions. But if you have any other suggestions, I'd like to
And
hear.
I think that the references too it can be subjective because you're gonna
Correct.
get good references.
All right, and nobody's gonna give you a bad reference, yeah, I mean,
And you're not gonna.
you're not
go-
gonna submit it if it's
Yeah,
bad.
You're not gonna go to, so I also think that one.
So what if we were to list, for them to list previous work experience, and then kind of like what you said, so they list 5 districts they've worked for, we'll take it upon ourselves
Yeah.
to get the references out of those districts. I know you said that, but score it that way as opposed to references.
Right, and that's, like I said, that's the direction, we're moving toward, because you see that a lot. You see, some people don't even turn in a reference, because the references are supposed to be mailed by the vendor, they're clients to us, and sometimes they don't do it or they didn't receive it, so then the person loses points. Secondly, nobody's gonna submit a bad reference. Like, if you're not gonna ask people who are gonna give you a bad reference, so you're kind of giving away points, but if we're moving toward us calling and asking the critical questions. Were they quick to respond to when the district needed this? How did they handle different areas? And so I think we get a better picture of their work quality. And so that one would completely be tweaked to that. The reference is based on our phone calls, not on what you submitted, so not a reference form. I kind of like that. I don't know how y'all feel about that, but that's, and I discussed that with FMO because we have a current project, and I just feel like nobody, I mean, it's kind of like when you apply for a job, you're not gonna give somebody who doesn't like you as a reference, you're just not gonna, you're gonna give, so we're kind of giving away points, and everybody does well giving, but if we make the phone call and ask those questions, like,
I'm sorry, Ms. Gonzalez, we're gonna go in circles here pretty much.
Yeah.
We need to decide this as a board, because we're the end user, so I'd like to start discussing,
Yes,
this.
I totally agree.
Okay, so let's
Yes,
get
sir.
to it. I mean, for example, I like to take out number 2, which is 16 points, and put the 16 points on price. And
But-
then we're either done there, but I actually like taking away 10 from number 4 and getting it to 26 on price.
But remember, if we go with the RFQ, there is no price. It's
Oh,
a,
okay, but, all right.
unless we go to the RFP, and
And we
Yeah,
could,
I
and we,
want to discuss an RFP.
and we have,
if I could say something, we can.
we haven't decided that
can
yet,
merge
so I don't-
them. We can do an RFQ with a RFP with a Q. We can say, still ask for the qualifications, but with a P, with a price, like the RFP/Q. We can do that. Where
Is
we're
that-
saying, show me your qualifications, but price is gonna play a game, play a role.
Yeah, and
It-
Are y'all,
That's an excellent suggestion.
that's awesome. Thank you.
does anybody feel differently from
Take out
that?
number
Are we
2,
good?
which is give
Okay.
throwaway points, put it on a price, 16 points right there.
Now that we've cleared up the RFP, RFQ/P, that's where we're gonna go, right? Now, we're gonna put 16 as a suggestion on price. Does anybody see it different?
I see where you can find more points also on item 3, experience with firm.
Yeah.
Take away those 10 points because you're interviewing the firm, you're not interviewing just one attorney in the firm, you know what I mean?
So on this section, what we typically do is say, we ask them to list who's gonna be working with us, and from that, we take the average, and that's what we get at who's can actually work. It doesn't matter that you have a veteran person that's got 40 years' experience if they're not gonna work with us. Who are you gonna assign to the district, and how much experience do they have?
That's
Okay.
good. So
It's,
what I-
and
what
so
I-
we could take an average of all the attorneys that they list that will work with us.
Where did you take the 16
I
from?
got 16 from number 2.
Okay, so you just
And
moved,
then what,
Okay, go ahead.
to trustee Crane's, I went number 4.
why do you say that?
I actually took out 5 points from experience with other districts, and I took out 5 points for general law experience and gave them just 30. So that's 10 I added to the price, which is 26, which is a little higher, not, we're not looking for.
So you, help us again real quick. So on price number 1, you went 26.
Right.
On 2, you put what? You took
0.
16 away, so that's 0, okay.
Yeah, because if they're not in good standing, they're not applying.
Yeah.
All right, so quality of vendor services, that stays 30. Number 4, you went from 50 down to 30?
To 40.
To 40, okay.
And the general law, school law experience, 35, 30, so I went to 30. To me, experience with other districts, I think we can call them, so I just gave them 5 on that.
All right.
And that's where I came up with that, but
All right.
So,
Has everybody written this down again?
yeah, the only
Okay.
thing that I would add, Sam, is a
Yes,
little
sir.
bit more to to number 4, I would add to the attorneys available to service, to make sure that there's somebody local in-house,
you want to raise that one up?
Yeah.
Maybe take 30 down to what, 25,
25
20?
and add 10 to that.
Okay.
Make that one 10.
Yeah,
Yeah.
I think
Yeah,
it's
that's
important for
fine.
them to have somebody here.
All right. All right, so at this point, if everybody on their list has 26 on number 1, the blue, 0 on number 2, which used to be 16 because they were moved up. We go down to number 4, that goes from 50 to 40. Right below that, general school law, that would go from 35 to 25. Again, this is still conversation. The next line, attorneys available to service, would be 10, up from 5. And then experience with other districts would go from 10 to 5.
And do we leave the word districts in there or institutions?
Doesn't matter.
We can change
Well,
it,
it
yeah,
does.
it can be
It does
consistent.
if we go back to the other
Yeah, I
part.
like
Yeah.
that institutions.
Institution's fine.
And on that general school law, we can break it down further if we want to do construction, special ed, and then break down those 25 points, if you want me to break it down further, so we can get a true vision of what they have,
But
like,
we're not requiring them to have that, it's preferred.
correct.
I think
So-
that could be something that during the interview would be a great
Yeah.
question for
Yeah.
us
Okay.
to just put up.
If we were requiring it, definitely give them some point weight, we can discuss that on our own, but
Yeah.
it's a preferred
Okay.
skill set, not a required one, so I wouldn't put a weight on it.
Yeah. Anybody see it different?
No,
I
Let's do
do,
it.
I see it different. I see it the way you said it, weighted.
By area?
But we're not requiring it, we're not requiring them to have that, we're asking that it's preferred.
Yeah.
Because they're gonna encounter those situations while they're here, so we're not, why would you give them points if it's not required?
Well, I think what trustee Alicea is saying and what Mrs. Gonzalez is saying is that that's 25 points on their general school law experience, is all you're doing now is breaking it down.
Yeah.
So you would
yeah.
take the scope of work, and that's, I'm using that as a guide.
We can do that
You would-
internally though, on our own.
Well, yeah, but I think again, if you hear me out, is they're saying it's still 25 points, but now you break it down into the various elements.
Like 8, 2, 3, 5, and add up to
So it's not
25.
so subjective, so it's,
And- and
It's more
it-
precise.
more precise.
It
Yeah.
would make your evaluation quicker
Not
because we
subjective.
plug it in for you, and
Yeah.
we'd pull it from what they responded. I'd plug it in for you, submit it, and you don't have to do much math. It's gonna be done for you, and it's gonna be clear on
That's good.
where
Yeah,
it
because
came.
it's very subjective, like what, I mean,
Right.
how many, yeah.
But on
It's going to cause more
retrospective,
questions than answers.
So, and with all due respect, if they give me 25 points and I see it different, then I, as the end user, I'm gonna change it in the interview process. So this is a guide, we don't have to stick to it though, right?
Well, the reality, under the,
Once we publish
No,
it,
the
yes.
25 points, I understand, but if I decide that, and you're grading it, each firm, and you grade 123, I might say, no, I disagree, I'm gonna give it 25.
Well, what we typically do is we do either a weighted scale, which, with a formula on Excel, so there's no there's no
Right.
opinion.
I
It's
understand.
literally,
That's what I like.
it's with the formula, and the highest experience is gonna get the most, and everything is gonna be distributed evenly
Yeah.
on a sliding scale. So there's no, well, why did you give them 8? Because the formula, it computed that way.
It's something that.
it breaks it down.
It's a, yeah, it's a sliding
explainable
scale.
to somebody,
No,
yeah.
I understand it, so maybe I'm not saying it right. So, we're gonna, let's say we have 5 firms and you rank them, okay? Using this, we still have to interview them.
Correct.
We still choose based on who we want. So, I understand what you're saying, I agree with that, but the end of the day is, we're, based on what we see, let's say general school law experience, we start interviewing them, and I see different the way it's graded because of what they presented, then I'm gonna vote accordingly.
Yeah,
Well, but let's say 20 firms apply,
Uh-huh.
and we decide to only interview the top 5
I get you.
ranked. So
Fair
then
point.
that does matter.
Yeah, I hear you.
And at that point, you could go 2 directions. We would provide you with what came out on the computer as the rankings. And then you could determine, okay, we want to interview the top 10, or if they're all
Gap.
close together,
Yeah, a
that
break.
wherever the gap
Yeah,
is,
the break.
and then
We're not bound though, let's say it's the top 5, we can still choose, like the superintendent search, we added.
you can,
I'm not
yes,
saying
you can interview all of them.
We can-
You can do,
right.
yeah.
That's
And then
what I'm
at that point, based on the interview questions that you develop, you could either say that, for instance, the interview question is going to be worth 50 points. So they can either bring their score, whatever they ranked here, say they scored a 98, they'd bring it, and they could score up to, 148.
I understand.
Or they could start from 0 and just do 50 points for the interview. It's whatever you determine, but it's just getting them to the interview, like this, yeah.
I'm just trying to expedite it, because the gentleman back wants to watch, North Carolina, the game.
well, yeah, and a fair argument could be made that,
Watch it on the phone.
He's watching it on his phone.
I do too,
Trustee Vela, if Trustee Coronado, you're good?
I'm good.
Trustee-
Just a question, if I may, Ms. Gonzalez.
Yes, sir.
Past relationship with the district, clarify that for me.
So in years past, like I think as long as I've been here, we've kind of revised that because a lot of the times there used to be too much weight. When I first came in, it was too much, in my opinion. And I think what the board felt too, there was too much weight, so it was never gonna allow somebody to be able to come in. So we gave it a 1 point out of, it used to be, I wanna say 10. So if you're a
When
mom
I
and
got on, it was
pop,
25 points.
you're never gonna get business.
But what's experience?
It's
One
having done
letter-
any,
One letter from their law firm representing the district is
just having
experience?
done business with us, like
So
we
everyone
look,
gets on the point?
not necessarily. If they don't have a PO generated, we don't give them the point. So we,
How far back?
ever.
Oh, they're all gonna get.
I mean, we can limit it though, like we can,
I'm just asking,
Yeah.
they're all gonna get a point.
It's fair
You have
point.
a good point to your point.
Even at that point, though,
It should be 2 points.
But-
to add on to
we
that
can
point, what if it
determine
was
the
a
length.
negative experience with the district?
right, yes.
Deduct a point.
Let me
Then
be
you-
honest with you.
So it could be negative and they wouldn't get the point. And it's only 1 point out of 100, so it's not a lot, but I didn't want to penalize somebody who's trying to,
And who determines if it was negative?
I guess there had to be some documentation from that. I can't be opinion, it's got to
Do your
be.
meetings go like this with all the end users? No, right?
But-
They do?
Adele's nodding.
You know, yeah, they've been my end user and they know it takes.
If they're
it takes hours to do
solution-oriented,
this,
it's gonna be
yes.
like this. This is a
Yes.
solution.
This is
problem solving.
a daily occurrence.
You're actually experiencing what actually happens on a day-to-day basis.
Yes.
I'm trying, but I don't wanna rush
Welcome
folks.
to my world.
We're all
Tru-
good.
Trust, well, yeah, Trustee Vela brought up a point, and we moved past it too quickly, and I think we need to come back to it. Item 4, the third one, experience with other districts.
Institutions, right?
So we are changing to institutions, okay?
Yes, sir.
I just want to make sure, because I
On,
didn't
on the
catch it.
breakdown, did we decide on that general, did break it down after all on the different areas, or what did we decide?
I'm sorry?
The general, school law experience, were we gonna break the
That-
25 points
It's going to be,
down?
the consensus that I heard was to break it down. Is there anybody see it different, or just doesn't see it?
How many points?
No, there's still 25
It's
points.
still 25 total, but the 25 broken down, my recommendation would be whoever uses our general counsel the most at this point, in that area, give the most points. So in other words, not every single thing we wrote on the scope. But for instance, I know that his team uses, and my team, we use general counsel often, so I'd probably put a big emphasis on those areas, construction contracts, and make sure that they're well-versed in AIA contracts, that they're well-versed with any type of things that they do with that experience, and break the 25. That's my recommendation, whoever uses.
Do you have
legal
that
counsel.
written down anywhere, what we're just saying, what you're just saying?
Not at the moment, but I mean, we could probably come up with something pretty quickly,
I think
yeah.
you need to come up with it before we
Yeah.
leave this room.
Yeah. So I can tell you right off the bat, for me, it's construction, MOUs, interlocal agreements, procurement, like that area, that's highly important to us, and
All right, just again, to summarize, we're going to get clarity on that in a little bit. and
so he's got his list already too.
I got you. So right now, it's 26 points on price, 0 on reputation with the vendor with vendor's goods and services. It's 10 for state bar, good standing, reference attribute, it's 6. The quality of vendor, number 3, vendor's goods and services is 30. And then it's number of years with the firm.
Mr. Saldívar,
yes.
sorry to interrupt. You said the state bar, you said 10, but we omitted that whole section, so it's 0 points.
Okay, let me
The
back
10
up.
and the 6 are gone now.
Yes, I'm sorry, I misspoke. You're right. It's
Okay.
0 for that whole thing. You're right. Thank you. Appreciate that. And then we get to line 4, that should be 40 instead of 50, which is the extent of which the goods serve. General school law experience, that's 25, and we're going to get a list of subbing that down. And then attorneys available for service, 10, and experience with other institutions, 5. Any other thoughts, changes? And again, the 25, we're going to get subtext, weights,
I don't want to
totaling 25.
I would recommend, how would you rank the HR issues?
See, bear in mind, once you do that, we're going to have our conversation as to what that weight should be.
So far on the breakdown,
There's no way you can put that on the screen?
I wrote it down. So I put, on the 25 breakdown, I put construction and procurement for sure on my end. And then Mr. Miller's saying HR related, so we can pull from that, their experience with HR related. Ideally, we have a number that's divisible by 25, make it easier, like maybe 5 items, so it can be 5 each, or.
I would suggest
it
that,
would
but let's not create them. What are the
Yeah.
actual scope of work
Yeah.
for which you need an in-house counsel? And forget that, take that and now apply it to general counsel, that you normally would use them.
Okay, but
So
that's
let's not
all
make it
HR
up. It's
related,
gotta be
so that would
real.
be here. But only 3 things we want? You don't, there's not another area? Do you feel like these are HR related?
We decided how to dinner, huh? It's that plumbing work you had
Aren't
to do.
those, isn't that Beekler? Isn't that Beekler? That's-
I hear you.
Lunch, Mr. Suarez?
The worst is upstairs.
These are all HR related, okay. Unless we break them down and make these somehow, I just feel like it's so,
Tony, you want
okay,
some?
for
I
me,
don't want any
construction
of
and
it.
procurement are the biggest things.
If it's
So
not
you were
UTR,
saying
DB, I'm
HR
not
related, So
interested.
do we weigh this more than these?
Bees up,
Like maybe
baby.
do 10,
It's gotta be,
8,
the
and
restaurant
7?
we normally go to.
You do that?
No, because
Right.
if I, when you're not taking
If you
me
need,
for-
you can list these examples. This is
Yeah.
Sophia's
consistent
avid.
compliance, and then these are other day-to-day
She's
stuff.
what?
She's an
Because,
avid sports fan.
Okay, I'll take Cargill.
I'm even willing to
If
give
we're
you
looking,
points.
okay, so school law, that's very generic, like school law. Well, unless we do this section, we won't do that section, we do that
What does it have to
too.
do with my basketball game?
Kansas.
But,
North Carolina.
and then,
Are we,
like
are you,
real
are
estate,
you
like a
doing
lot of
lunch
it's
too?
important, personnel, so I maybe that one. And
Now, if I lose
personnel,
both of y'all,
yeah.
we're gonna go to Waterbury.
So 1, 2, 3, 4, where's procurement? There's the procurement in here.
If I win, you're not taking the lead
Yeah,
pharmacy.
that's already got it.
It's the best bird.
As well as this procurement in here? Yeah. Okay, so we have 1, 2, 3, 4, and then anything, see, those are more like, I mean, everything's good, but, you know.
Sophia, you can ride with me.
I'm taking
Okay,
from this
so-
document here, so
so
following that.
What Mr. Miller and I kind of,
Go
from that document, and I'll put it on the screen, we propose that those 25 points, we break them up from 13.1, whatever they, 13.1.1, which is school law and public law, 13.1.3, which is construction and architecture law, 13.1.5 employment and labor law, and 13.1.7 personnel law. That's our recommendation. I think that's where we see the heaviest.
So those are the three, so it'd be three and you divide?
And so those are 1, 2, 3, 4. And they don't have to be even, like if you feel that something needs 11 points, and so it's not divisible, 4 is not divisible, 25 is not divisible by 4, but we can work with the numbers. You can do a little bit more in an area.
So there's 4, I think 25. So what if we just?
School law, construction, 2, 3, 4. I mean, they're all important, but I guess we're trying to
Just give
just,
the school law the extra points.
Yes,
because it's more, it's, okay.
yes, and then
So
divide the rest.
then-
Everybody see it different?
So 5, 5. It's split, 15.
Don't cry.
So 10 for school law, 5 for construction, 5 for employment and labor law, 5 for personnel. Is that good? That adds up to 25? Okay.
All right, that works. There are some redundancies, obviously. I mean, the thought would be that there were different segments of the organization. For example, school finance, that would get, and then you got HR, and then you have procurement and, I mean, that would have made more sense to me,
Right.
but that's fine, let's move it along. Any other thoughts? Are we good? So we got this instrument. Okey-dokey.
No more items, right?
No, we haven't even
Just
gotten to
beginning.
we haven't gotten to the nitty-gritty, which is the budget. So unless there's any other items to discuss in that particular, we'll move to 5B, discussion of the district staffing and salary information. Dr. Gonzalez.
Yes, sir, Mr. President. The Human Resources.
Thank you very much, Ms. Gonzalez.
Thank you.
The Human Resources Division will present information on district staffing and salaries based on the Texas Association of School Board TASB analysis, along with potential 22-23 salary increase scenarios. We have Mr. Todd Miller, our Assistant Super for HR, who will share more information, and this item is for information purposes only. Mr. Miller.
Thank you, Dr. Gonzalez. I want to start off by thanking our board and trustees for all the time and dedication you put into what you do for our district and for our kids. Tonight, I will present some HR-related information as part of the 22-23 budget process, and joining me tonight is the HR directors, Mr. Stan Crowns and Mr. Jonathan Bassos. Make sure they didn't leave for tip-off time. Director of Benefits, Mr. Andy Silva was here earlier, and of course, Mr. Sandra Gomez, thank you for being here, for our compensation analyst. I'm going to try to go through this as quick as I can. The agenda tonight we'll discuss the strategic plan, budgetary challenges, and district actions, compensation plan strategy, teacher market comparison, 5-year review, and also where we're at in 21-22. Total years of experience, newly hired teachers and librarians, targeting teacher salary in Texas, total years of experience, teachers and librarians, average teacher salary in Texas, history of salary increases, and we'll end up with the proposed salary increase by pay group. The strategic plan there is goal 2, people development, and strategy 2, attract and retain high-quality staff. In the interest of time, I'll move on. Budgetary challenges, of course, continued declining student enrollment, increasing healthcare and prescription costs, as Andy talked about earlier, revenue projections from local, state, and federal sources. District actions that we're taking to counter those challenges is validating all staffing vacancies and teacher-to-student ratios, validating current and one-time expenses, evaluating multiple healthcare benefit strategies to address escalating costs, and repurposing and realigning positions to maximize efficiencies. Compensation plan strategy. What is compensation? So, as we talked before, compensation is our base salary, our stipends, extra duty pay, and a comprehensive benefits program, which includes health, dental, vision, prescription drugs, life insurance, TRS contributions, and EAP. So on the chart, you'll see I tried to put some numbers to this. So an employee's true compensation also includes the contribution amount MISD pays for each full-time employee. For example, medical, the district pays $440 per employee per month, plus dental $18 per employee per month. That totals $458 per employee per month times 3,300 employees times 12 months. Equals $18,136,800. Average of $54.96 per employee annually. TRS is 2.55 of employee salary for 3,300 employees. The district pays TRS $3,515,000 annually. Break that down by 3,300 employees. That's an average of $1,065 per employee annually. Total annual district contributions for medical, dental, and TRS is $21,651,800 annually, or an average of $65.61 annually per employee. That's a very important number, so that's a number that really should be added on top of their salary that they see in their paycheck, but that is what the district is paying for those benefits. Starting pay matters, but it's not everything. Know your market. Bear with me. So we benchmarked ourselves against local district compensation plan, and we coordinate with local HR departments to benchmark best practices. I think the best example I'm really proud of is MISD, as y'all approved, thank you, we're the only district in the valley to offer the 5 additional local leave days. Everybody else was doing the 5 COVID days and things like that. I think that's important to not lose track of. Focus on developing employees for career progression and succession planning. Developing career progression and advancement opportunities to recruit and retain employees. Ongoing succession planning activities has resulted in multiple internal promotions. And efforts also aimed at ensuring McAllen ISD remains the district of choice for our employees. Pay strategies take a multi-year approach. This current year, the starting 0-year teacher is $51,000. Back in 16-17 is $45,800. We use equity adjustments to help ensure all employees are paid at least 90% of market median. The goal is to ensure all full-time employees earn at least $10 an hour, and currently our lowest pay is $10.35 an hour for full-time. Differentiate pay increases, the targeted equity adjustments for decompression and to reward loyalty and dedication, which will be to make sure we focus and don't lose sight on decompressions. The goal is to maintain competitive salary levels for recruiting and retention purposes. And we use stipends in hard-to-fill areas and areas of high need. We focus on high recruiting and retention areas. Example, secondary math, science is $2,000. And stipends are benchmarked against local market to ensure competitiveness. So teacher market comparison, this is from TASB. The top line, 21-22 out of 11 districts plus McAllen. You see where we fall. Unfortunately, we're in 8th in the 0, 5, and 10-year categories, 7th place in 15-year category, and also the 20-year category. And average salary is 6th place. I'm sorry. Despite losing some ground in the local markets, McAllen ISD still has a higher starting teacher pay, $51,000 in Region 1, which I'll show you in a little bit, $50,200. We also have a higher average teacher salary paid, $57,596 versus Region 1, which is $56,610. And our average teacher pay is 102% compared to the local market. So although that slide's kind of negative to some degree, I'm proud of those few facts because we're trying real hard as a district to be competitive. This is the 21-22 school year. The red line shows McAllen ISD is compared to the market median. The numbers I just read out to you is across the bottom line there. So in the 0, 5, 10, 15, and 20 year is the MISD salary. The next line down is the TASB local market median. So for example, I'll just use the 10 year. McAllen is 55,080 and the local market median is at 57,768. So this slide is kind of important, and I'll have another slide here at the very end of the presentation on the salary recommendations. So you'll see that gap kind of in the 10 to 15 year kind of starts to widen a little bit. So pay attention to that if you will.
Mr. Miller, if I can interrupt really quick. That's a bit misleading in the sense that that does not include the amount of benefits that we provide in terms of the insurance coverage as opposed to other districts. I've heard from several teachers who have transferred from other districts to McAllen that our insurance is much more competitive and much better than districts where they were at. Is there truth to that?
That's definitely true. You'll see this slide right here in the middle, the yellow highlighted part on the right-hand side. So the district pays an average of $6,561 annually per employee. Do we lose teachers? Do we lose employees other districts that pay more money? Yes, we do. But you'll see a couple slides here in a little bit that we're also getting employees that have double-digit and high double-digit.
I knew that. I was just getting you ready for that slide. Making sure you're awake.
We talked about it in committee.
Yeah, okay.
You were there, right?
That's a very good point. And And Mr. Salvador, I think you've talked to us recently, or last couple of years, about compensation statements.
Yes.
And we was going down this road on compensation statements. Excuse me, I'm trying to talk fast. This tip-off's already gone.
No, take your time.
No, we're fine.
So we looked commercially to get these compensation statements done, and it was, to be blunt, cost prohibitive. So we stopped, took a step back and said, look, we can spend that money better elsewhere. Let's look in-house with the new Skyward system that we've recently implemented. So we're working with the Department of Technology to get the same or similar information with all the, to be blunt, without all the bells and whistles, but yet the same message that, look, here's $6,500 that the district is paying on top of your normal salary that you gotta count. So a lot of these people, they go into these other districts, they do come back. A lot of our, you see them at the board meetings in closed session, all these people are coming back external. Well, they're leaving districts that pay more money than us, but they're coming back to McAllen for a reason, and it's obviously not just pay, so.
It's the names listed that the HR presents to the board, not the individuals themselves.
Yes, sir.
Yeah.
Okay, so, there's that chart, teacher market comparison, so I'll go on to, this is the data that we show every budget year, it just kind of gives you how we compare to the other local markets. To the left side is less than McAllen, so in the zero year, you'll see Brownsville, Mercedes, and Sharyland pay less than McAllen. I won't go through each bucket, but
Yeah.
you'll see where they're at. I'll move on to the next one. So this is total years of experience, newly hired teachers and librarians. So on this one here, 150 teachers and librarians new to the district in 21-22. And yes, we have a big piece of that pie, 45% of 0 years. But I'll look to the top left part of that pie, and there's 32 teachers, 22%, that have 11-plus years. So this is what I was talking about, the people coming back to the district, or coming to the district, excuse me, with double-digit years of experience. The starting teacher salary in Texas, I think this is good. Last year, Region 1 was number 5 in the state. This year, we're number 4. And again, as I said earlier, McAllen ISD is above the starting teacher salary that Region 1 has is $50,200, we're at $51,000. Richardson is the district that dropped below us this year.
Go back 2 slides, though. Can I misread that?
Which one?
Go back to the one more,
Gotta be 3 slides.
3 slides, yes.
Can't go back.
Now you froze his computer.
Oh, you couldn't go back.
It went the first half.
It's because he downloads all that Gator stuff.
North Carolina's gonna win, so it doesn't matter. Because on that one slide that you showed, our annual at 51, there's other districts ahead of us. Yet you said right now we're number 1 in Region 1.
Okay,
I think it's total, I think you're thinking total compensation package.
Total, it's not salary.
Doesn't have to be, it's compensation.
You're referring
Totals
to,
don't matter.
are you referring to the slide right here?
Yeah, you said you were number 1, right?
In Region 1,
Okay, go back to the other slides. Is Donna not, or someone was paying more unless my contacts are off?
Don is hired. If you go to the, McAllen is the black, you're talking about
Right,
this
so
bar
the
here?
other school districts are ahead of us.
To the right is ahead of us, they're higher?
Yeah,
Yeah.
so aren't they Region 1?
The Region 1 is average, let me go back to that real quick. So
Oh,
the
okay,
bottom
so
left, average enrollment per
We're
district.
beating the average, we're not number
Yes.
1. Okay, there's a difference. Okay,
Sorry.
all right. Just a point of clarification, I'm sorry.
That's quite all right. Thank you.
We're beating the average.
And in total years of experience, teachers and librarians, 23 teachers and librarians, and this one here you'll see. Yeah, so this one here you'll see, like for example, in the 30-plus years, we have 98 teachers at 30-plus years of experience. If you look at the top 3 areas with the red, green, and the purple, it's 336 employees, or 21% of our employees are at 21-plus years of experience. So we're definitely on the top side of that. That's good. We're retaining the employees, and on top of that, we're gaining employees in those buckets. So we're growing our team. The average teacher salary in Texas, Region 1 is number 4 again, and we're above what the Region 1 average is.
And again, we're only talking about salary. I think if as Trustee Suarez mentioned earlier, if we get to a point, as the state's wanting us to do, all districts, is to look at the total compensation package, we're in a much better place.
Yes.
And so what I just heard a while ago, just so I understood, is you're working within the district with our software technology to be able to capture those other elements of their compensation package. Is that what I understood?
That is correct. So everybody will have a piece of paper to walk away with and say, oh, my true salary is this and this and this and
My true compensation.
true compensation,
Yeah.
sorry, yes.
The salary's X, and then here are the other elements to my total compensation. Because the statute's written as a compensation from the state. And so we're moving in that direction proactively.
Yes, sir.
Good, thank you. That's great to know.
So this chart shows the history of salary increases, so it's kind of busy, and I apologize if it's small. I hope you have it on your computer, sir. So the chart shows the history of salary increases. All district employees have received a salary increase every year except for 2009, 10, and only teachers and librarians, counselors, nurses, and speech pathologists received a pay raise that year. 11 and 12, no employees received a raise. That's $4 billion cut from Texas legislature. And of course, recently in 2020, 2021, no employees received a raise due to limited funds, but there was a $300 December stipend that we was able to fund. 1819, as you see, is the TRE-related salary increases. 1920, HB3-related salary increases. In 21-22, we did a 2.5, and teachers got a $1,410 increase.
It's good work on this, by the way.
So, working with TASB and the business group, this is the proposed salary increases. And the top rows is scenario 1.0%, 1.5% is in the middle, and the 2.0 is in the bottom. So I'll go across the top. 1.0, what does that mean to teachers, librarians? Only $565. It's 1% of the pay range midpoint for everybody else. The second to the last column on the right-hand side is all funds total. So if we went with 1%, it would cost estimated $2.8 million. And general fund impact would be $1.8 million. We'll slide down to the second one, 1.5, excuse me. It's $850 for teachers and librarians, 1.5 of pay range midpoint for everybody else. And the total cost is $4.1 million. Impact on general fund is $2.66 million. And the bottom row, there is 2.0%, $1,140 for teachers, 2% of pay range midpoint. Total cost is $5.4 million, and general fund impact is $3.85 million on 2.0. So I'm going to go show you a couple of charts, and we may end up coming back to this. So what does the 1.0% look like? This is the chart I showed you earlier with an addition. So the red line is McAllen this year, 21, 22. The blue line is the market median, and that dotted line is if we did 1%, what does that look like? It doesn't move us very far, as you can see. 1.5%, same thing. Red is McAllen, blue is the median, and the dotted line is a 1.5 proposal. And the administration is recommending the 2.0%. So you see the red line is McAllen, the blue line is market median, and the dotted line is going with 2%, how that closes the gap at each of those 5-year marks.
Is there a way, and of course, you're not going to have the information for everybody else, but to show what the adding the other elements of the compensation, what that might look like? With a caveat that this is not apples to apples, because, not even same fruit, because the other districts don't have, but just to see where we might be. Is there a way, or is not?
We could add, what's that number, 60, sorry.
It's not required, I'm not asking you to change anything. If you have it like on your, fine, but if not, that's fine. Because
I
the
don't-
reality is it doesn't tell us a whole lot because we don't know what we're comparing to, because what we're comparing is
We'd
just
only be
salaries.
able to compare to ourselves.
Exactly. Never mind. I spoke out loud.
Sorry.
Sugar low, haven't eaten. Sorry.
That's why I stepped down, ate a cookie real quick.
I should have eaten, yeah.
So the administration, as I stated, is recommending the 2.0% general pay increase, which is $1,140 for teachers and 2.0% for all other employees. And that concludes my presentation.
All right. Any questions or comments from the board?
Mine's more of a comment, and I've expressed this quite a few times. I think just by where our fiscal year starts and finishes, I think we set the bar. We could come out and do a 2%, pay raise, and other districts are going to say, well, McAllen did 2%. And then they're going to go, how do we beat that? And then they'll go up and they'll raise the bar. And that's what keeps us middle of the field in comparison to being on top. And it's just, that's the way our calendar year runs, is what I understand.
That is true. For example, I have notes here, local districts with the same budget cycle as us, and it's Mission, Brownsville, Raymondville, Sherryland, and San Benito. So very few of our local competitors.
And how do we rank compared to those that have the same budget cycle that we do?
So if you look at Mission, let me go back to the 0 year. Mission 1, 2, 3, they're third at 0 year. 1, 2, 3, 4, they're fourth at 5 year, second at 10 year, top at 15 years, so, and third at 20. So that's just Mission.
I mean, I think that's one of our
Cherryland's more to our left sometimes.
unfortunate downfalls is that, because we come out so early, we set the bar, and all the competing districts say, well, now we know what McAllen's paying, now we know what they've done increase-wise, how do we top that to lure their teachers away? Of course, their compensation packages, as we've discussed multiple times, doesn't compare to ours, so they're seeing a bigger number, but when they get there, their insurance is higher, they're not getting as much paid into the TRS, and that, that'll cause that boomerang effect in a couple of years, so people will come back and rejoin the McAllen ISD family.
That's what I'm just gonna say. We ought to do is pull our data together, but that's where some of these district employees are coming from. So now they're nearby districts,
Right.
but it's not all about the pay.
And just piggyback off what you said, Trustee Flynn, I think the other factor is that our other school districts, they get funded at different rates than we do.
Of course.
They go build a school and they're gonna get 80%, 9% back. We build a school, we're getting less than 10%. So
Right.
our administration has done a really good job. I take that back, has done an exceptional job doing what we can for teacher pay with our salary. I think that the answer lies in the more help from state legislators. For us to consider us, Port Isabel and Sherryland, in a different category than our neighborhood school districts just crazy to me, but, that's a whole different. I do think the 2% is fair. I think it's, we did a good job in conjunction with administration, giving that one-time bonus this past year to help, our teachers through COVID. And while we'd like to do more, we discussed some of the challenges we're facing with healthcare and others. 2.0 is pretty fair. So I think we're at a good point. Hopefully, if we do get some more funding, Ms. Richards, I know there's something I saw last week, or Governor Abbott talked about the funding, but there's more funding down the road that I'm sure as we can revisit this. But for now, you feel comfortable with the 2%?
Yes, we do.
Any other comments? Trustee Eliseo.
Ms. Richards, so that I don't have to go and create my own spreadsheets like usual, could you, you know me, I don't like the across the board. Can we try a scenario? So if the number is 5.4 million that we have to play with, can we try 4% for the teachers and 1% for everybody else? And see if we get to that same number, that 5.4 million? Can we see what it is? Is it 3.5% for the teachers, 3%, 1%? Can we work the numbers and see different scenarios instead of just across the board?
We sure can.
Thank you so much.
And I would think you want teachers and librarians. since
Yes,
they're only
that
in the same
class,
category.
teachers,
Okay.
librarians,
Yes,
counselors,
definitely.
nurses,
I understand.
that class, you know what I mean.
All right. Any other-
Thank you, because I don't feel like we're doing the spreadsheet like usual.
Any other thoughts, questions from the board?
Mr. Vela?
Well,
Trustee Vela.
I was just gonna make a comment that a higher percentage for the teachers is, well, it's not equitable if you have a lower percentage for, it's fewer dollars is what I'm trying, it's not 2% of their salary, it's.
It's 2% of the median market value.
2% of the 5.4 is not the same as
Right.
dollar amount, same all the way across.
Right, right, but
So,
the-
but I see where you want to see the scenarios, and I totally agree. That would, for popular discussion, if you will.
Yeah.
And just for clarification, it is 2% of the median market value
Right.
Right.
for teachers, right?
Yeah, so that's
Just for
And the
clarification.
midpoint for all that.
Of the
And
midpoint.
midpoint for everybody else.
But the math doesn't translate to dollars the same. That was my
Right.
point.
No, having said that, that's not the case for the salary employees. The salary employees is different. It's not 2% at midpoint. Isn't that a different figure? Isn't,
No,
it's 2% for them as well. Well,
Yeah,
then,
because depending on the years of experience.
yeah.
Yeah.
And to the point raised, I was accustomed in business is that there was differentiation. Of course, there was bonuses and other things for leadership based on other things, but that there is a difference between in our case, putting it into a practice here, where you're dealing with professionals and you're dealing with support personnel. So I would think you'd have to group them with the professionals, teachers and librarians, your administration with, and administration, I know, and this is the tricky part because it captures everybody within administration. It's not just the assistant superintendents, directors and that, right? And it includes support staff and principals attached to that too. So I don't know, I mean, I wish we'd have these conversations throughout the year because I do think there's some legitimacy to having these different percentages based on group. And when you look overall, that it gives you a medium for the whole organization. But it's going to maybe be 3% for this group, 5% for this group to get somewhat of a medium dollar amount, which is what we're talking about here.
Yeah, for auxiliary and instructional support.
Exactly. So I would think in fairness, as we move forward, and I would see if you agree, that you kind of have to differentiate those others as well, and looking to see where does it come out to a 2% medium for all. But looking at it maybe different for the leadership, which includes principals, at a different rate than your auxiliary staff and your professionals, and see what that might look like. It's better to have that up front. The elephant in the room, let's discuss it. It may not be now, but I think we need to be thinking about moving in that direction. The other is to Trustee Forina's point. I know there was a reason we moved from a September timeframe to a July 1st, and it had to do with the way the funding streams were coming in and how it positively would impact us when we were having a dire strait in finance, because it gave us an extra month of money as we needed to move us forward until the legislature made some decision, which they ultimately did. But it was a harrowing period of time, and probably more so to you than anybody else, because you knew what was happening. But that was the recommendation. Are we at a point where it would make sense to move back to a September? And just, don't have to answer today, we're not ready.
Well, the moving of fiscal year is not something to take lightly,
Yeah.
or speak of lightly. There is a lot of background work that occurs with moving an entire system back 2 months. When we moved over to the July 1st start date, that was in essence a 2-month savings to our fund balances, which it created. Moving it back, I would suspect it's a 2-month loss to the fund balance moving
Yeah.
forward. In addition to that, it's just the manpower it takes to make sure that the conversion occurs in the year of conversion. At this point, I don't know of a district that's actually converted back to August. Typically, the districts that have moved to July 1st have remained at July 1st start date. And again, it's not a light conversation, because it was a lot of labor when we moved it back.
And we do feel very comfortable with this budget cycle, and we don't feel that if we did change to the August, that it would have a profound impact on the ability to give higher raises or anything. We'd still be in the same situation we're in with regard to our fund balance.
I think the ultimate answer, and it's something we've been talking, and it's something I've been pushing for from the very beginning, is you got to show the full compensation so everybody fully understands and appreciates where they are in relationship. And when they go and seek out, is that they ask those inquiries before they jump, because it's a lot harder to get them back and then retool them back to our way of doing than to let them go. So getting to that compensation letter, outlining all the benefits and the salary, I think is the key. That's probably more beneficial than any change in our current fiscal cycle. Any other questions or comments? Hearing none, do I have a motion to adjourn? Moved by Trustee Suarez, do I have a second?
Second.
Seconded by Trustee Peña. All in favor signify by saying aye.
Aye.
All opposed, nay. The ayes, 6-1, the ayes have it. We are adjourned at 8:47.
Now you owe me lunch, 12 by 6.